Oh, I need this. Hold on, guys.
Just hit remove. Just remove Twitter. So that's going to be an issue. That's fine.
Okay, I need to go over here. My StreamYard isn't up, or StreamDeck isn't up.
Oh. Here, go ahead and start the lecture. I'll get it going.
All right, get the StreamDeck going for me. Class 1. Okay, good morning. Thank you. Awesome. Now I can see. Okay, good morning, guys. This is the first class of the CNA test prep program. It's 4 weeks. We're here on Mondays and Wednesdays. So not Monday through Wednesday, Monday and Wednesday. Please don't come tomorrow. I won't be here. Won't do you any good. Mondays and Wednesdays from 9 a.m. until 1 p.m. We do try to start pretty close to 9. I try not to be too late because we do have people that are joining us virtually from all over the world. We will end at 1, maybe even 1:02 or 1:03, depending on how long-winded I get. I have a lot of information to cover with you. I will talk nonstop for the next 4 hours, except for a brief 15-minute break that you get. Other than that, I will be talking nonstop. It's a lot of information that we're going to cover, but you don't need to worry about taking notes. I've already done all of that for you. We're going to get into that in just a few minutes. So the only thing that I need from you is to stay reasonably awake, especially for the first class. This class, we're going to lay a foundation that every future class is going to build on. So this really is the most important class out of all of them. Okay. I also need from you, if I'm going too fast, you need to tell me. If you're not getting the concepts, you need to let me know. I need feedback from you to make sure that this class is going to meet your needs. Sound fair? Sound fair? I do talk a little bit fast because I got a lot to say. If I'm going too fast, please, somebody throw something at me and I will slow down. This room generally has 2 temperatures, hot and cold. It probably will feel a little bit cooler to you than to me because I'm standing up and moving around. So I'm not an effective gauge of temperature. If it gets too cold, somebody throw something at me and I'll adjust it. Okay, sound fair? Class uniform, you guys are all good right now. Starting on Wednesday, you have your class t-shirt that is up here on the table if you haven't gotten it already, labeled with your names. You can just wear any comfortable pants. We do want long pants, not shorts, please. Any comfortable pants and closed-toed shoes. So sneakers, flats, just something that covers the foot. Okay, sound fair? Easy. You'll need that for the rest of the classes. Snack center is in the back. Bathroom is all the way in the back to the right. Smoking area, if you are out front, please make sure if you're a smoker that you put your butts in the bucket that's out there. Don't just leave them on the ground. We try to keep it looking pretty nice. We usually open the doors about 10 minutes before class. If you're an early bird, go get a cup of coffee. I won't be here until I'll literally be rolling in about 10 minutes before class. I'm not real good with morning time management. I'm working on it, but I'm not there yet. So just kind of keep that in mind. This is an in-person class. You guys are all sitting in the classroom, but we do live stream this so you can attend virtually. You will also get links to the replays as well. We'll go over that in just a little bit. And you're going to get some review worksheets at the end of every class. Now, if you're attending virtually, if you can't make it to class and you're watching us virtually, the website has those same worksheets that we're going to hand out. So you guys will be able to access those worksheets as well from home. And we're going to send you a wrap-up email. How many of you guys got the welcome email? You guys get the welcome email? Okay. If you did not get the welcome email that I sent out yesterday, it didn't go, by the way, that I sent out yesterday, Please see me after class so I can verify your email address to make sure that you're getting these wrap-up emails. This is super important. It's going to give you links to things that we talked about in class. It gives you the live stream replay link, but it also gives you some extra information that will be very relevant to you. So you definitely want to make sure that you're opening those wrap-up emails. And you'll get free access to the online course. We'll talk about that a little bit later on as well. This is me. I'm Patricia Laramie. I'm an RN. I have been doing this class for 17, 18 years, something like that. Long time. We're very well known in the community. Most of the people that are hiring you started in my classroom. So we're very, very well known in the community. We are also the #1 YouTube channel for CNA skills study. So we're being used by schools and facilities and individuals and training centers and employers all over the country. So some of them are even tuning in today. That's going to help you guys when you're looking for a job because we are so well known. But it's going to help you before you get to the job. It's going to help you with the test. I am a subject matter expert on prometric testing. I know the test forwards and backwards, inside and out. I'm going to demystify the test for you, explain what they're looking for and how to make sure that you pass. And I know that's your focus. You've got to get past that test to get into the workplace. And how many of you guys are a little nervous about that test? Yeah, it's normal. I'm not focused on the test. I'll make sure you pass it. That's not the issue for me. I'm not focused on the test. I'm focused on the day after the test when you guys go to work. When you are working on real, live, breathing humans, that's when it really matters. Did you learn what you needed to learn? Right? The test is a formality. We have to get past that. I'm going to teach you in a way that makes sense. So you'll pass the test. But I don't want you to forget what we learned in here when you start working with real live humans. Because someday I will be the body in the bed. I'm getting older. I will be the body in the bed. And I want to make sure that I've got people to take care of me in the way that I would take care of somebody else. Sound fair? Okay. All right. So in front of you, you got a whole stack of stuff. Don't stress. We are going to get through all of this in 4 weeks. But we're going to, yeah, I am. Okay. But we're going to do it in a very logical, methodical manner. But 4 weeks is going to go by super quick, guys. My students tell me every single session I have, oh my gosh, it's week 4. We're graduating already. It seems like it just started. It's going to go fast. So if you get behind in your homework, there's not a whole lot of time to get caught back up. Does that make sense? So for the next 4 weeks, Alexa, stop there. No, stop. No. Yeah. Yeah. Okay. So for the next 4 weeks, you want to try to budget your time so you can kind of stay, in line with the class so you don't get too far behind. All right. So you got these 2 books. This one is your homework book. It's going to go home with you today, and it's going to stay home. You don't need to bring this one back and forth to class. This is strictly for homework reading, but you are going to bring it back to me on the last day. This is loaned to you, but you're going to give it back on the last day of class. Don't bring it back and forth. That gives, a lot of wear and tear on the books. Just take it home, leave it home for reading. This class, or this book, though, we use in class. This is the workbook style book that is going to put into practice what you're learning. This one was written by me. It's got my name on it. So if you can't remember who I am, just look on this on the front cover. This book is used by schools all over the country. We are the number 3 textbook for CNA training nationwide. This is a workbook style book. It's yours forever. You're going to write in it. You can highlight, you can make notes. This is yours. Please don't write or highlight in this one that you'll be returning to me. Good. I'm going to explain how to use these books in about 2 hours. But just know that this one is going to have all of our notes for what we're about to talk about now. Okay. And you can write in this one. All right. So with that being said, go to page 17 in that spiral book. We're going to jump right in. So page 17, you see a graphic that looks like this. It says skill rules. And it's got all these little puzzle pieces off to the side. Each one of these represents a skill that we're going to learn. And these rules apply to all of these skills because they're all highlighted. So the very first thing we have to learn in class are these rules. They're called skill rules, and they're going to apply to everything. If you look on that back wall, you see all those colorful banners on the back wall? We are going to learn all of that, everything on that back wall by class 4. Now, you're not going to memorize. Memorize doesn't do you any good. You have to learn them. There's a difference between memorizing and learning. Learning requires application. Memorizing is just memory work. So we have to learn all of these principles, and this is where we're going to start, is with skill rules, because every skill is going to follow the skill rules. And when you're looking at this page, you can see all of the principles here that we're going to be learning. This is the one we're focusing on. The rest of them are kind of grayed out. And down here, I've got a video on this, skill rules video. What is that? Page 18, if you just flip the page, these are the notes for the video that I'm about to show you. Remember I said that I took the notes for you? These are the notes for the video that we're going to watch together. So we're going to watch a video on this. Good morning.
I had a little bit, we were confused about which location. I'm sorry. Let me just let them know, okay?
Okay, sure. So, come on in. Yep, you can just have a seat anywhere where there's books, and you can get your t-shirt on break. Okay, so on page 18 of the spiral book are the notes for the video that we're about to watch. This is the video right here. So you can always review it at a later date. Hello. Good morning. Are you here for class?
Yes.
Okay. All right, you can just have a seat. There's one there and one there. And you can get your t-shirts on break. Okay, so we're in the spiral book on page 18, and we're going to watch a video together. And the notes for that video are on page 18. The video takes about 10 minutes or so, and it has a lot of really useful information, and it's going to form the foundation that we're going to build on for everything that's coming. Okay? All right, Jake, go ahead and the CNA. Why it's always about the care plan. A presentation brought to you by 4YourCNA.com. Thank you for joining 4YourCNA's online CNA test prep. We will be preparing you for both the written and skills portion of the exam. This course contains videos, interactive lessons, activities, testing care plans, test registration instructions, practice questions, and much more. This program goes way beyond our skills videos available on YouTube. But in order to pass the test, there is one single principle that you must understand: the importance of the care plan. Without this key, learning the skills is meaningless. You might be able to mimic what I do in the skills later, but chances are you will fail the test because you didn't follow the care plan. So this course will teach you the skills, but you must first learn how those skills need to be done. So come on inside and I'll explain to you how the care plan works and why it is so important to the test. We are sure that you will become great CNAs and you will provide excellent care for our residents. But before you get started, let's review some basics. Does anyone know what the initials CNA stand for?
Certified Nursing Assistant?
That's exactly right, April. A nursing assistant is there to assist the nurse. You will be receiving all of your instructions from the nurse and must follow their directions. This will probably include taking vital signs and assisting with personal care tasks. But you may also be asked to assist with other nursing procedures as well. It is important to only do the things that you have been trained to do. If you aren't sure how to do something, ask someone for help. It's okay to not know everything. But please, don't try to do something that you aren't familiar with. It might harm the patient. In this online CNA test prep program, we're going to show you how to do all tested skills. But that is only the beginning of your education. You will learn way more on the job. Because every patient is different and will have a different way that those skills need to be done. And that's where the care plan comes in. As a CNA, you will be expected to assist our patients with many routine tasks. Generally speaking, CNAs help patients with things that they can no longer do for themselves. Things like sleeping, toileting, grooming, bathing, dressing, eating, socializing, and activities. Together, these are called the activities of daily living, or ADLs. These are things that everyone does every day for a healthy life. But not all patients will be able to do these things for themselves because of illness or injury. Sometimes people are too weak to go to the bathroom on their own or feed themselves. And that's where you come in. If a patient needs help with any of these tasks, you will be there to help them. But not all patients will need help with all tasks. This is Henry. Henry had a stroke and has right-sided paralysis. And this is Martha. She had a left hip replacement. This is Bob. He has had a recent leg amputation. And Annie has dementia. And they will all require different care. Some patients will need help brushing their teeth, but others will do that themselves. As a CNA, we will help the patients do the things that they cannot do alone. But we will let them continue to do the things for themselves that they can do.
How will I know what I'm supposed to do with each patient?
I'm so glad you asked, Cassie. As the registered nurse caring for these patients, that's my job. When a patient gets admitted to our facility, I will do a head-to-toe assessment. I will review all body systems to evaluate the patient for real problems and potential problems. This is a very long, complicated process, but here's a brief overview of a general assessment. I'm going to look at his neurological status. I'm going to look at his cardiac status and his respiratory system. I will also look at his integumentary system, which is hair, skin, and nails, and his gastrointestinal system. His urinary system is important, as is his musculoskeletal system. And then I will review his endocrine, lymphatic, and reproductive systems. And finally, I will review the doctor's orders for this patient. I will use all of this information to determine the patient's real and potential problems. Here's an example to put it into perspective. Let's say that this patient has just had a right hip replacement. Now we know that she will need to continue her activities of daily living. She still has to eat, drink, go to the bathroom, bathe, groom, and dress. And after my assessment, I know that she did all of those things herself until today. However, she cannot get out of bed for any reason for the next 3 days. So, since we know that she must stay in bed, I have to figure out how to meet all of her ADL needs. The easiest way to evaluate basic needs is using the TEAMS method: toileting, eating, ADLs, mobility, and special. As the RN, I'll take all the information I gathered during the assessment to figure out the best way to help her.
She can't get out of bed, so I have to figure out the best way to meet her elimination needs, bedpan or catheter. I also know she is at risk for constipation, since she's not moving much and she's on pain medication. This is a potential problem. She can feed herself, but the trays must be brought to her in bed. She can't sit all the way up because of surgery, but she can't eat lying flat either. She has dentures, so they must be within reach at mealtimes, and they must be cleaned daily. She's able to clean herself as long as the supplies are brought to her, but she can't reach her legs or feet, so she'll need help. She is on total bed rest for 3 days, and she also needs her dressing changed every day. You can see how the RN uses all the information available to create a plan of care specifically for this patient. This is called a care plan, and it's something that only an RN can do. Of course, this was a simplified version of the care planning process. A real patient's care plan is much more extensive. Every single aspect of her health, condition, and ability level will be evaluated in order to help her. Even the smallest decision can have long-term consequences. The RN will write a detailed care plan for the entire healthcare team to follow, and the care plan must be followed exactly.
So every patient will have a different care plan?
That's correct, Ben. Every care plan will be different because every patient will be different. Even patients that seem alike because they have a similar diagnosis or have had the same surgery may have differences in care. CNAs don't have enough education or experience to know all the differences. So as a CNA, your job is to read and follow the care plan for every individual patient. In fact, you could say that your job is to follow the care plan, the whole care plan, and nothing but the care plan. Do you think you can do that? Can you follow directions exactly?
I can.
Absolutely.
Sure.
Yes.
Awesome. Then you're well on your way to being a great CNA. But helping patients with ADLs isn't all that you will do. You are also there to help the nurses by making observations. The CNAs are the hands and the feet of the patient. If the patient is cold and cannot reach their sweater, you will get it for them. If the patient can't brush their own teeth, then you will do that for them. If the patient can't get up to shower, then you will help them stay clean. You will become their hands and feet to help patients with things that they can't do themselves. But you are also the eyes and the ears of the healthcare team. You will report everything you see, hear, smell, or feel to the nurse. This is the most important task that you have as a CNA. If you see redness around a wound, you must report it. If you hear the patient wheezing after walking to the toilet, you must report it. If you feel that a patient's skin appears warmer than usual, you must report it. If you notice that a patient is coughing when eating, you must report it. As a CNA, you will be spending much more time with the patient than the nurse does. So you will be in a position to notice a lot more about the patient. The nurse needs this information to make decisions about the patient's care. Reporting these observations gives the nurse another assessment opportunity. That new assessment may even change the tasks you are assigned to perform. This is called the nursing process, and here's how it works. The RN assesses the patient and develops the care plan. This gives you specific tasks to do. While doing those tasks, you notice things. You report those observations to the RN, and the RN performs another assessment to review the changes in the patient. That new assessment prompts changes in the care plan, and this gives the CNA new tasks to do. And the cycle continues around and around as the patient gets better or worse. This is a continuous process until the patient is discharged.
I'm not sure I understand. Are you saying the care plan is going to change all the time?
Yes, it could, depending on the needs of the patient. Let me give you an example. The care plan told you to make an occupied bed in room 201. As you changed the sheets, you noticed that the skin on the patient's backside was red and irritated. You notified the nurse, who then reassessed the patient. The nurse decided that the patient needed to be repositioned every 2 hours around the clock. This was added to the care plan as another task for the CNA. Using this model, we can respond to the needs of the patient quickly as their needs change. But it also works for patients that are getting better too. You've been assisting Mr. Hopkins with transferring out of bed and into a chair after surgery. But you notice he isn't leaning on you any longer. You notify the nurse. The nurse reassesses the patient and decides that the patient can transfer on his own now. The care plan is changed, and this task is removed from the care plan since the patient is improving.
Doesn't this mean that I'm going to be bothering the nurse all the time? Won't they be annoyed?
The nurse should never be annoyed with you for reporting changes in the patient. They are legally liable for every aspect of that patient's care. Since the nurse requires that information to plan the patient's care, they expect to receive updates from you on the changes that you see. But how often you will have to report changes to the nurse will depend on the setting you are working in. Nursing home patients are pretty stable and don't really change all that often. That's pretty common for long-term care facilities, like nursing homes and ALFs and even home care. But in other settings, like hospitals, rehabilitation centers, and hospice, patients' health can change rapidly. In those settings, nurses and CNAs are going to work closely, and constant communication is required. Since CNAs must follow the care plan and are not allowed to alter it, they can't solve problems. The RN is ultimately legally responsible for the care of that patient. If you have information about the patient that you're not giving to the nurse, the patient can suffer, and the nurse is legally liable for that. Remember, you are an assistant. You are there to help, but the nurse is always in charge of the patient. So all changes, regardless of how minor they seem to you, must be reported to the RN. When the patient is stable, you will not have much to report and may go days without talking to the RN. But if you notice something, then it must be reported, even if you don't think it matters. If you aren't reporting observations, the nurse can't rely on you anymore. And if the RN can't rely on you, then you aren't a good assistant to that nurse. You must report to the nurse everything you see, hear, smell, or feel. Be a good assistant and report all changes and observations. This is the most important job you have. So the care plan is developed by the RN, gives the team tasks, CNAs follow the care plan, and report changes. Let's recap what we learned today. Can you tell me how a CNA knows what each patient needs?
The care plan.
As a CNA, you follow the care plan, the whole care plan, and nothing but
The care plan.
anything unusual that you notice about the patient, you must report it to
The nurse.
Great job. For the exam, you will receive a care plan. What should you do?
Follow it exactly.
That's correct. If you don't follow the care plan, you will fail the exam. It's that simple. Now that you understand the care plan, I can show you how the skills will be done for the exam. But remember, you must always read and follow the care plan. That's a big part of the skills exam. Take the brief quiz below to make sure you understand. See you in the next lesson.
Oh, sorry. Should have given you a warning. All right. Okay. Make sense? Do we know what to do with each patient now? No two care plans are going to be exactly alike because no two people are exactly alike. And that's the biggest thing that we have to learn is following the care plan is a big part of what we do. So the video talked to us about activities of daily living. And this really does kind of define the role of the CNA. So think about everything you did this morning. Okay, X says, if you notify the nurse of any new marks or redness, but they say it's fine or normal, would you still chart the observation? That's a great question, and it's really going to depend on the setting that you're in as far as documentation. Not all settings allow CNAs to document in words. And we'll talk about that a little bit later on in the program in week 3. So it really depends on your facility. But if you have reported something and you don't think that it's being addressed, you can advance it up your chain of command. So go to your shift supervisor and then maybe the assistant DON and just make sure that that patient is receiving the care that they should be. But yeah, sometimes most of the time, the nurse has information we don't have. So we pass the information on to them, the observations on, but it's really up to them. We're going to talk about liability in a few minutes. So the video talked to us about activities of daily living. Think about all the things you did this morning when you got up. You got out of bed. You probably went to the bathroom. You may have gotten some coffee. You probably did some grooming, brushed your teeth, brushed your hair. Some of you bathed. You got dressed. You might have grabbed something to eat, and you got yourself here. That's a whole lot of work before 9 a.m., right? And those are things that we do for ourselves every day. We don't even really think too much about it. It's just our normal routines. Well, things that you do every day are called activities of daily living. So this is going to encompass things like, movement, sleep and rest, dressing, bathing, eating, toileting, all of those things. Now, as long as you can keep doing them yourself, you will. You will. We don't like people getting involved with our personal stuff unless we absolutely have to. But what if you woke up tomorrow morning and neither one of your arms worked? Well, now you're kind of in trouble, aren't you? Because you can't really go to the bathroom very well if your arms don't work. How do you get your clothes off to do that? You're in trouble. How do you brush your own teeth if your arms don't work? How do you brush your own hair? How do you get a cup of coffee? All right, you're in trouble here. You need some help. So for most of us, our first call is going to be mom. Hey, mom, come help. But what if there is no mom? Then we're probably leaning pretty heavy on our significant other. Hey, honey, I need some help. Right? But what if there isn't a significant other? You might call a close friend, but man, they'd have to be a really close friend to help with these tasks. But what if you didn't have one? Well, now you're kind of relying on the professionalism of strangers. And we want to make sure those strangers are well trained and can do those tasks safely and not cause us more harm. Right? Does that make sense? That's why you're here. This is what we help most patients with, our activities of daily living. And trust me, if that patient can brush their own teeth, they're going to. They do not want you in their mouth if they can brush their own teeth. Thank you very much. So we're going to help patients with things they would normally do for themselves, but for some reason can't. So we've got to be professional while we do this, because this is embarrassing for people. These are things that they would want to do themselves if they could. So we want to have some tact. We want to have professionalism. But most of all, we want to learn how to do these things safely so that we're not causing additional harm. And that's the type of things that we're going to cover in this program. So this was the care planning process. Now, the care planning process in the video, the RN assessed the patient. So when a patient comes into the facility, my job is to look at the patient head to toe. I'm looking at all real problems and all potential problems. And I'm looking at all of those ADLs that we talked about. Are they going to be able to brush their own teeth? Are they going to be able to feed themselves? Are they going to be able to get up out of bed by themselves? What are they going to need help with? And as I figure out what they need from us, I'm going to develop something called a care plan. And that's going to tell us what to do with that patient. Make sense? Good. So that is the RN's responsibility. They assess and develop the care plan. Now the CNA, we're over here. We follow the care plan. Now that care plan is not just written for CNAs though. The care plan is written for other nurses. It's written for physical therapy, for speech therapy, for dietary, for activities. It's written for the entire medical team, not just CNAs. We have a small part of the care plan. It's going to tell us what to do. But the care plan is way bigger than just CNAs. But we look at our tasks and we perform them. But while we're performing those tasks, we need to make observations. This is half of your job, guys. Actually, it's 2/3 of your job, if you look at this. We perform, observe, and report, right? Observation and reporting, that's 2/3 of your job. This is what sets a CNA apart from all the other alphabets. Have you ever heard of a home health aide? Patient care tech? PCA? Nurse tech? Right? We've got, it's an alphabet, like all these letters out there, right? This is what sets the CNA apart from all of those. All those can do this. They can do the tasks. CNAs are responsible for observing and reporting. Do you see how important that is? If you're not making observations and you're not reporting those observations, you are not functioning as a CNA. You guys got that? So the question that X just asked is a very relevant question. They observed something and they reported that observation. They functioned as a CNA. Good job, by the way. If you observe something and then you decide in your mind, oh, that's not important, I'm not going to report it, you have now just functioned as the nurse. You don't have that ability. Good? Make sense? So if you notice it, you report it. Any questions on that? Okay. So let's go to page 20 in your book, your spiral book. And we're going to see if you truly understand the concept of the care plan. Now, in the little coffee cups on each of your table, you've got some pens. So if you don't have a pen with you, remember this is workbook style. So you are going to read each of these 8 questions and answer them. We're going to, okay, why isn't that on? I'm going to give you 5 minutes on the clock. Go ahead and oh, that's why. There we go. So for those of you joining us virtually, this book that we're going to be working in the program can be ordered at this website right here. When you're done with the questions, go ahead and put your pens down so I know who's still working. About 2 more minutes. If you don't understand the purpose of the care plan, everything else that I show you will mean absolutely nothing. Because care plan is where we get our instructions. This is what trips up most people that are going to take the state exam. Is the state exam is going to give you a care plan. Now, we know in the first 30 minutes of class, we've learned that you follow the care plan. As long as you read that care plan and follow it, you'll be fine. But most training programs out there don't teach about the care plan. They teach you how to do hand and nail care, how to brush somebody's teeth, how to ambulate somebody. They teach you the how. But if you don't know this piece of it, that's going to be a problem when you get out there in the real world, because we're not brushing everybody's teeth the same way. Make sense? So those that don't do well on the test, it's mainly because they don't understand the purpose of the care plan. All right. Anybody still working? Everybody good? Okay. Yeah, just leave it. Okay, if you didn't get a chance to finish, you can finish that up on your own. But let's take a look at this. Oops. Let's take a look at some of these questions. There's a couple here that I want to go over with you. Let's look at number 1 here. It says you receive the displayed care plan. How far will you walk the patient? What do you guys think? Why? Easy answer. Why? The care plan. The care plan said 10 steps. Now, why can't I just walk him until he gets tired? Okay, because the care plan didn't say so. That's right. I used to give this as a pre-test. You know, when you guys walked in here, right? We had a couple of minutes. So you were just kind of sitting there looking at each other, right? I used to give this. It was on your books, right? So when you walked in, this is the first thing that you saw. Before you take the class, do you know what you would have answered? Until they get tired. That's right. That's right. So understanding the care plan, I stopped doing that, by the way, because people got really, really upset that they would fail a test before they even got started, right? I got a lot of bad reviews on that. So I quit doing that. But that answer is there for a reason. On the state exam, that would be the way a question would be worded. So we have to follow the care plan. You're going to have a lot of questions on the written test that are specifically there to see, do you understand your role? Okay. Number 2 says, what's required to assist this resident? A gait or transfer belt. Yeah. Why can't we just go get a walker if we think they're unsteady? It's not in the care plan. Easy answer, right? We might think in our own minds, hey, this guy's unsteady. I don't want him to fall. I'm just going to go run and grab a walker and use that. That is not in your scope of practice. You do not have the ability to just go grab a walker. Good? Make sense? What do you think you should do? If you got to walk this patient and they're a little unsteady, what do you think you should do? If we can't just go grab a walker, what do you think you should do? Okay, yeah, very good, very good. So if we go back here, right? If we go back here, remember the RN assesses the patient and develops a care plan. We just follow that care plan. We report the observations. When we report the observation to the nurse, what does it make them do? Reassess the patient because something has changed. If we don't report that, if we just go grab a walker, the nurse doesn't have an opportunity to reassess. The nurse does not know that something has changed. And that gives poor patient outcomes. So as a CNA, we only have 2 doors that we can walk through. We follow the care plan or we notify the nurse. That's it. That is it. Those are the only 2 answers that work for us. We follow the care plan or we notify the nurse. It doesn't matter why we can't follow the care plan, we notify the nurse. So if the patient refuses a task, what do? Notify the nurse. If you can't find a gait belt, what do? Good? How hard can this test be, guys? All you can do is follow the care plan or notify the nurse. You now have all the information you need to pass the test. I'm not exaggerating. We still have a long way to go. I have a lot to teach you, but you legitimately have all the information you need to pass the test. You follow the care plan or you notify the nurse. Good? Make sense? All right, let's go down. You can, the others are pretty self-explanatory. And the answers are in the back of the book, but I want to go down here real quick. I want to go to 8. 8 says, how long do you need to count for? What do you guys think? Why? Care plan, right? 1 full minute. Guys, this skill, measure and record a radial pulse, is on the state exam. It is the most failed skill on the state exam. The most failed skill is pulse. It's one of the shortest skills there is. It's one of the easiest skills there is. It's the very first skill I'm going to start you out learning on Wednesday. It's ridiculously easy. So why is it the most failed skill? Well, how many of you guys know somebody that works in healthcare? Right? Most of you guys know somebody that works in healthcare. If you go home to your somebody, whoever you know that works in healthcare, and you say, hey, how do you guys take a pulse? You're probably going to hear, well, we use this little thing that looks like a clothespin, and we put it on the finger, and it gives us a number, right? Pulse ox. Or if you say, no, I mean, like, how do you actually take a pulse? Like, measure a pulse. They'll say, oh, yeah, you use 2 fingers, you find the pulse, and you count for 15 seconds and multiply that by 4. And that's how we take a pulse. And that is perfectly legitimate. Absolutely. That is how we take a pulse in most clinical settings. But for this patient, this one right here, how long do we have to count for? 1 full minute. There is a reason that the nurse does not want that 15-second count. There is something going on with the patient that says that is not good enough for this guy. I need a 1 full minute count. Well, if you watch a YouTube video on taking a pulse, there's hundreds out there. Most of them will tell you 15 seconds multiplied by 4. If you read your textbook, it'll tell you 15 seconds multiplied by 4. So all of the information out there tells you to take a pulse. It's 15 seconds multiplied by 4. So if you don't understand the purpose of the care plan and you measure the pulse by counting for 15 seconds and multiplying by 4, because that's what everybody in healthcare told you to do, you fail the test. The test is not about taking a pulse. What do you think they're testing you on? Following the care plan. Good? Make sense? Good. So if you know that for the test, you are being graded on following the care plan, wouldn't it be nice to get those care plans before the test? You want those care plans? These are the care plans from the test. Those are 4. We have 20 skills that we have to do. Here's 4 of them. You want the rest of them? I'm assuming you do. Okay, let's keep that in mind. On page 25, you're going to find the rest of them. We'll get there in a few minutes. Okay. But I'm going to give you all of the care plans from the state exam. They're public. They're published. They're things that I can give you. So when you get to the test, you know, for pulse, I have to count for 1 full minute because that's what the care plan says. It's not because that's what the test requires. It's because that's what the care plan says. There's a difference there. What do you think would happen if you walked into the testing center and the care plan did not tell you to count for 1 full minute? Right? I'm going to give you the testing care plan, but understand that they may change. So what would we do if we got to the testing center and it was a different care plan? Follow the care plan. Are you going to follow what I showed you, or are you going to do what the care plan said? Good. Makes sense? Okay. All right. So skill rules. This is our first banner. You can see it on the wall over here. This sets the tone for everything that we're going to do from this point on. We are going to perform the skill as directed on the care plan. And that's not enough. We're going to follow the care plan, the whole care plan, and nothing but the care plan. So I don't care, you know, your best friend's mama may tell you something. You follow the care plan. We don't change the care plan. We don't think to ourselves, well, if this, then that. No, it's the care plan. It is written in stone. Don't change it. That's where a lot of students get into trouble on the state exam. Their mind goes to, but what if? But what if? There is no what if. There is no what if. Because every what if I give you gives you a different answer. There is no what if. We don't change the care plan at all. Now, some of you are going to have a really hard time with that. You will. You will. Because those what ifs are sneaky. Your brain will do all kinds of things to you. So that's why I spend a lot of time forming this foundation. It's the care plan. I don't care what your brain is trying to tell you. It's the care plan. Okay, good. Those what ifs will get you in trouble. Remember, we follow the care plan or we notify the nurse. Okay. While we're following that care plan, we're going to observe. We want to use all of our senses except for taste. Please don't taste your patients. That's just wrong. But you are going to use sight. That's our most used sense when it comes to observation, but it's not the only one. We're also listening. Is the patient wheezing? Is the patient complaining? Is the patient groaning? You want to listen. We also use smell. If you walk into a patient's room and it smells like grape Kool-Aid, that's something you need to report to the nurse. Isn't that weird? Grape Kool-Aid. Why would I have to report grape Kool-Aid smell to the nurse? Well, if you look around and you don't see any grape Kool-Aid, something is causing that grape Kool-Aid smell, and it's a bacteria called Pseudomonas that produces a grape Kool-Aid smell. So if you walk into a patient's room and you smell grape Kool-Aid, somebody should know that. Good. So all of our senses feel, is the skin warm or is one side colder than the other? That's a big red flag because we are one body. If one side of the body is doing something the other side isn't doing, there's a disconnect. There's something wrong. We need an assessment. Good? Makes sense? So we're going to observe. And then what do we do with those observations? Report them. So you're going to have to be in contact with your nurse. But I get this question all the time. How much contact am I going to have? You know, how much contact is this going to take, right? How much am I going to be bothering that nurse? And what if I get a nurse that just doesn't want me to contact them? So those are two different questions, and they're both going to be handled a little bit differently. So the first answer is, how often am I going to have to report stuff to the nurse? Will depend on your work setting. How many guys want to work in a hospital? Yeah, very common. Most people want to start out in the hospital. And you may be perfectly fine in a hospital. But I want you to remember that hospitals are very fast-paced. There's admissions and discharges. You don't end the shift with the same patients you started with. It's constant change. If you are a person that does not do well with change, that is not a good environment for you. I don't care what you see on The Pit, right? Anybody watch that show? Oh, it's awesome. Yeah. ER misled you, by the way. Grey's Anatomy, yeah, there is no Dr. McDreamy, sorry. You have to assess your own skill level when you're going to go into a high acuity, fast-paced environment because it may not be the right fit for you right away. Fast-paced means you've got to have fast skills, and you probably don't yet. It's okay to be slow when you're new, but you can't be slow in a hospital. So those of you that are looking to get into a hospital might be the right situation for you. I don't know, but keep that in mind that there's a very high washout rate for healthcare givers that go right into a hospital straight out of school. So keep that in mind. I've got something that's going to help you decide the right place for you based on your personality and skill level a little bit later on in the program. If you're working in long-term care, like a nursing home, yeah, your patients hardly ever change. You know, Henry is the same yesterday, today, and he'll be the same tomorrow. There's not a whole lot of change going on. Very slow, right? Constant patients. Well, you're probably not going to have a whole lot to report to the nurse. You might go days or weeks without having to report anything. So it really depends on the setting you're in and how changing your patients are as to how much you're going to be interacting with the nurse. Now, the second question, though, is what happens if I have a nurse that doesn't like to be bothered? Find a new place to work. Find a new place to work. You are going to have a very high dissatisfaction level working there because the patients are not being cared for properly. Remember, the nurse's job is to assess and develop that care plan. If they aren't listening to you, if they aren't taking note of your observations, they're not doing their job. And who do you think is going to suffer in that situation? The patient. Now, the way that I'm going to teach you, you are going to develop a lot of empathy for your patients. And that's going to drive you crazy. When you know they're not being taken care of properly, it will cause you to be very dissatisfied with your job. So yeah, you can report the nurse, but honestly, guys, the facilities out there, they will take the nurses over you 100% of the time. And why is that? Should they? No, they shouldn't. They absolutely shouldn't. But why is that? Because nurses take a long time to train. long time. They have a lot of money invested in those nurses. You, 4 weeks, we can get a new CNA, right? So they will take the nurse's word over yours. It's sad. I wish it wasn't like that, but it is. So just find a new place to work. Develop friendships. You guys there's 15 of you in here. By the end of 4 weeks, you should all know each other. And what's your name? Vernaje. Okay. So when you go to work somewhere, let's say that you go into pediatrics. Okay. There's a pediatric daycare right down the road. You decide that's where I want to work. You go into pediatrics and you absolutely love it. What's your name? Tiara. Now, Tiara, you go to work at the hospital and you quickly realize, ooh, I don't want to be here. So you should call her up and say, hey, do you like where you're working? Okay. Make friends, because that is the most honest opinion that you'll get about a workplace, is from somebody who is actively working there that has the same level of training that you do. Good? Questions? All right. This is our Bible. We live by this. We follow the care plan, the whole care plan, nothing but the care plan. We make observations and we report them to the nurse. This is the foundation of everything that we do. It actually forms our scope of practice, which we're going to get into in a few minutes. So page 25 has all of the care plans for the state exam. And they're actually on page 25, they're actually grouped in sets, which is exactly the way they will be grouped for the state exam. When you go take the state test, and we're going to go over the test process in a little bit, but when you go take the state test, they're going to give you a care plan set that has 3 skills on it. It's going to look an awful lot like this. It's actually on yellow paper. Mine's a little prettier, but the words are all the same. This is what it's going to look like. Now, on this care plan set, there's 11 of them. You have all 11. On this care plan set, each one has a very specific grouping of skills. These are, again, published. They do not deviate from this. So that's what you see here. This is a care plan set. There's 11 of them. And each one of these has an ADL skill, a mobility skill, and a documentation skill. So everybody is going to get a documentation skill. When you go take the test, you're going to get a documentation skill. So will you, so will you, so will you. Everybody gets a documentation skill. There's 4 documentation skills on the state exam. There's pulse, respirations, feeding, and emptying the drainage bag. You will get one of those 4, guaranteed. And you will also get a mobility skill, and you'll get an ADL skill. You guys remember what ADLs are, right? Things we do for ourselves every day. All right. This is how they're portioned out. These are ADL skills, mouth care, feeding, mouth care, hand and nail care, denture care, partial bed bath, foot care, peri-care, catheter care, bedpan, occupied bed, and dressing a resident. There's mobility skills, all the range of motions, ambulate, transfer, and change position, and then the 4 documentation skills we've talked about. You will get 1 from each category, but they're divided up on page 28 for you. So all of this makes up our scope of practice. Anybody know what a scope of practice means? Scope of practice means what we're allowed to do legally. Legally. So scope of practice is a legal definition of your role. And on page 22, we talk to you about your scope of practice. Scope of practice is you follow the care plan and you report everything to the nurse. That is your scope of practice. But let me give you a couple of examples of why it's so important to follow your scope of practice. So let's say that we have an older woman who's a patient, and the care plan says that she has to be sitting in a chair at the side of the bed from 7 to 9 a.m. every morning. She has to be out of bed, sitting in a chair from 7 to 9 a.m. every morning. And at 8:15, you walk in because she hit the call light, and she says, "Oh, honey, my back hurts. Can you put me back into bed?" Can you put her back into bed? How many of you guys want to put her back in the bed because she's asking? Anybody? Okay. So you want to, but what? But can't. Why? Yeah, care plan says she has to remain sitting for until 9 a.m. Now that's really strange. Why? Why in the world would this care plan have somebody sitting in a chair for 2 hours every morning? That's just stupid. Why is that even in the care plan? It's because this patient takes a medication at 7 a.m. that if it comes back up into the esophagus, it will actually burn the esophagus. There is a medication that we give people early in the morning, about 7 a.m., and they have to stay sitting up for 2 hours to keep the medication down. Gravity. Right? If she lays back, all the stomach acid equals out and it can come into her esophagus. So just laying that patient down, you could seriously injure them. Good? Make sense? Sometimes CNAs want to do what they see nurses doing. Let me give you an example. There's a CNA who works in a long-term care setting, and they have all of their diabetics on one wing, and they have a brittle diabetic. Now, brittle means this patient is really hard to control their blood sugars. They're high, they're low, they're all over the place for no apparent reason, not real tied to food, or it's just like random. Okay. So brittle is very, very hard to control. So this guy, we'll call him Harvey, brittle diabetic, and he often gets pale and sweaty and jittery, and the CNA goes and reports it to the nurse every time, and the CNA watches the nurse mix sugar and orange juice, mix it up, and gives it to the patient. They always get better super quick. And on this particular day, patient got pale and sweaty and jittery, and the nurse is off the unit. There's no nurse there. The covering nurse, because the nurse is on break, the covering nurse is dealing with an emergency. So the CNA has a patient that is pale, sweaty, jittery, and she knows what the nurse does. So she throws some sugar and some orange juice and gives it to the patient because, there's nobody there. Is that the right answer? Why? Didn't follow the care plan. That is correct. This patient actually went into a diabetic coma and died because the signs of hypoglycemia are often the same as hyperglycemia. What the CNA did not know was the patient had a continuous blood glucose monitor. So when the CNA reported the symptoms to the nurse was able to see what the patient's blood sugar was at that moment. CNA did not have that information. A lot of what the nurses do, you will not see. So you can't do the things that you do see because there's always a piece of the puzzle missing. Good? There's a couple other examples here. If you want to see why we have to follow the care plan, there's some scenarios there that'll help you see that a little clearer. Okay, good? This really is our scope of practice. This is the banner. Some of you can see it from where you are, some of you can't, but this is the banner on the wall. This is what it looks like. You are going to have a lot of questions on the written state exam about your scope of practice. But more importantly, when you get out there and you start working, that's where all your questions come in about your scope of practice. Am I allowed to do that? Am I allowed to do that? Am I allowed to do that? So we have to have a way of you being able to figure out what you are and are not allowed to do. So we have 5 key phrases that dictate your scope of practice. And of course, our foundation is we follow the care plan, the whole care plan, and nothing but the care plan. So if it's not on the care plan, can you do it? No, that's a piece of the puzzle. But let's say we do have something on the care plan, but it's not something you're really familiar with. This is what defines a CNA task legally. Normal. CNAs do normal. Now, what does normal mean? There's a definition. A routine task. Routine. On a stable patient. And you've been trained to do that task. It's also on the care plan. So let's say that you have a care plan that tells you to brush somebody's teeth. That's routine. Okay, so far, so good. It's on the care plan. It's routine. We like routine. But this patient is not stable. They're actively choking. Is that in our scope of practice? No. So even though it's routine, remember the patient has to be stable. That is correct. CNAs do not do emergency processes because emergencies require judgment. Now, there are some exceptions to that. We'll talk about things like choking, fires, burns, heart attacks. We're going to talk about emergency processes. But routine tasks on stable patients is what defines our scope of practice. Do you guys understand the difference there? Okay. Routine task that you've been trained to do. Now, let me talk about training. A lot of people think training has to be like this, in a classroom with one instructor standing in front of you, yap, 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 maybe some videos. That's actually not the only way you can be trained. You can actually be trained one-on-one at the bedside for that particular patient. So training can just be you and the nurse with a patient. That still counts as training. What doesn't count as training is, oh, I'm not really sure how to do a tube feeding. Let me pull up a YouTube video. Okay, that is not training. You guys see the difference there? Okay, so if you haven't been trained to do something, can you do it? No, if the patient isn't stable, if it's a routine task, but the patient isn't stable, can you do it? No. Good? Make sense? If it's not on the care plan, can you do it? Okay.
But okay, so as a CNA, are we going to be able to like feed them through tubes if they have to?
Mm-mm.
No, because we're not trained for that.
No, that's not considered stable,
Okay.
believe it or not. Yeah. It may be routine,
Right.
but the patient themselves is not stable. It may be a routine task, but the patient is not stable.
What if the nurse insists on training the CNA how to feed through tubes?
So you have to, okay, there is another part of this that I'm going to get into in just a second called delegation. We're going to talk about that in just 1 second. So I'm just going to kind of time out. I will cover that, but let me get there. It's right after this. The next thing we have to look at are how to do the task. So we know we're following the care plan. We know it has to be a routine task on a stable patient that we've been trained to do. But how we do those tasks, there's some rules involved. And that's what we're going to learn on that back wall. So we've learned skill rules. So out of the 11, you've got 1 down. Congratulations. Good job. We're going to move 2, or we're going to learn 2 more today. But these principles govern the how. A lot of safety in here. This is going to govern the how. Okay, this governs the what. That governs the why. This governs the how. You guys see that? And above all else, above everything else, it's all about the patient. Yeah, we're going to follow the care plan, but above all, it's about the patient. So we tend to get all caught up in these things, right? We as CNAs, we're technical. We get all caught up down here. But if we don't remember why we're doing this to begin with, this stuff really doesn't matter. If your patient does not feel cared for and cared about, they don't care how well you give them a partial bed bath. They have to feel cared about and cared for, not just cared on. Does that make sense? So we're going to talk a lot about patient rights as we go through this program too. And then our most important principle over everything else, whoops, where'd it go? I'm missing one, is to report all observations to the nurse. I just redid these slides for you guys. The last class, I've added like 100 slides to today from, I've been using these things for like a year, so I had to revamp them. I must have missed one. So report all observations. All right. Why is that? Okay, Jake, make a note. Slide 19 has to be fixed. Okay. Or slide 20. Sorry, slide 20 has to be fixed. All right, so let's talk about delegation now. This is going to come up often in your career. A lot. I'm plugged in a million CNA groups online, and these questions are all over the place. Am I allowed to? Am I allowed to? Am I allowed to? Am I allowed to? The short answer is probably. But there's some rules here. As a nurse, as an RN, I can delegate tasks for you to do. So in this class, we're going to learn how to do 20 tasks, plus hand washing makes 21, but we're going to learn how to do 20 skills. And you'll be able to do all of those skills out there because you've been trained to do those skills. But there's going to be other skills that you may have to learn based on the population that you're working with. Okay? So what's your name? Brianna. So Brianna, let's say that you go to work in a mother-baby unit. You are going to have to learn to swaddle. And you're going to get really, really good at swaddling infants. You can burrito that baby up just as good as anybody else by the time you're done. You're going to learn how to swaddle. And you're going to be trained to do that. What's your name?
Simon.
Simon. Now, Simon goes to work at a assisted living facility. He's not swaddling anybody. Okay? So there's no sense in me teaching you swaddling in this class, because those skills aren't going to be used on a wide range of people. So it depends on where you go to work as to what additional tasks you need to learn how to do. And a lot of times the nurse is going to say, hey, I need you to. And your question is going to be, am I allowed to do that? Am I allowed to do that? And the answer is there's some rules here. So if we go to, all right, so 22 is wrong too, by the way. Okay. So this is in your book on page 14. So nurses have to answer some questions when it comes to delegation. The first question I have to consider is this something that I'm even allowed to do? Because as an RN, I can't delegate something that I can't do. So I'm not going to delegate. What's your name? Nate. I'm not going to ask Nate, hey, can you go put a trach in this patient for me? I can't do. That's not even in my scope of practice. I certainly can't delegate it to somebody else. So that's rule number one. And I know that sounds really silly, doesn't it? But it has to be there for a reason. So the first question I have to ask myself as a nurse is, am I allowed to do this? The second question I have to ask myself if I want to delegate something is, does my state allow an unlicensed person to do this? So let's go back to your scenario with the tube feeding. Most states do not allow CNAs to help with tube feeding. That's at the state level. Now, there are some exceptions to that. If you're working with disabled individuals, those that maybe through APD or one of those organizations, there is a consideration for that. But for mainstream medical, CNAs do not do tube feedings. Okay. So I have to know the laws regarding delegation. The next thing I have to look at is, does my facility allow an unlicensed person to do this task? Now, certified CNAs are certified. Certified does not mean licensed. They're two different things. So does this facility allow me to delegate this? Then I have to look at you. Okay, so I go through all those. Can I do it? Does the state allow it to be done? Does my facility allow it to be done? Those are my top three questions. If this is to all of those, now I have to look at you. Have you been trained to do this task? That's my next thing. Have you been trained? And the last thing I have to look at is they're going to require any judgment? Like if I ask you to go do something, is there a high likelihood that something's going to come up that you're not going to know what to do with and have to make a decision? Do CNAs make decisions? We follow the care plan or we notify the nurse. So if I delegate something, but the patient isn't stable and something is probably going to happen and you're going to have to make a decision, that's not a good delegated task. So there's a lot that the nurse has to go into to get here. So if a nurse is asking you, hey, I need you to do this thing, the nurse has gone through all of those criteria. Good? Does that make sense? So the nurse thinks that this is a good task to delegate. And they're saying to you, hey, I want to delegate this task to you. Now, that nurse works with 476 CNAs on all different shifts. She is not going to know what extra skills you've been trained on, what extra skills you've been trained on, what you know how to. They're just going to give you a task. Your responsibility here is to say, hold up, I haven't been trained to do that task. They're going to assume you know how, because they don't know what you know, what you don't. They're just going to assume. So your responsibility is to say, no, I haven't been trained on that. Chances are they're going to say, oh, okay, come with me. I'm going to train you real quick. Or they may make an appointment with staff development to get you the training that you need. There's some different facilities do this a little bit different. Good? Make sense? So if the nurse says, I need you to, and you haven't been trained, what do you say? Haven't been trained. That's not me. Should you pull up YouTube and try to crash course it? Now, something else that you're going to see on the written test, very important that you know, CNAs are not allowed to delegate. Nurses delegate. CNAs do not delegate. Remember all that stuff that nurse had to go through to delegate? Right? Can I do it? Is it allowed legally? Does a facility allow it? Is the patient safe? They have to go through. CNAs cannot delegate. So if I ask you to do something and you don't know how to do it, you can't turn around and assign it to her. Okay. There's going to be 2 or 3 questions on the state exam that are going to try to get you to delegate. That is not in the scope of practice of a CNA. Your responsibility is to say, I haven't been trained. Refuse the task. Good? Make sense? You don't get to pass it on to somebody else. All right. So let's talk about liability, because that's really what this all comes down to, liability. And a lot of CNAs are very concerned about liability. You don't have to be, because you have none. CNAs are not liable as long as they are following the care plan, doing tasks that they have been trained to do, and reporting everything back to the RN. You have no liability. The nurse or the licensed individuals, licensed equals liability. Make sense? Licensed equals liability. CNAs do not have liability unless you are operating outside of the care plan. So let me explain to you how this works. Let's say that this lady came into our facility. I went in as the RN. I did a complete assessment, head to toe, figured out all of her real problems, all of her potential problems. And I wrote up a care plan for everybody to follow. Now, I'm a big fan of written care plans. Have you ever played that game Telephone where I tell you something and then it goes all the way around the room? What happens when it gets way over there? Oh, yeah, it changes. So I'm a big fan of written care plans, but not every place will have written care plans. Sometimes we're doing stuff on the fly, and I may just tell you that's perfectly okay. Still a care plan. Still a care plan. It came from a nurse that assessed the patient. It is a task that you are assigned to do. Doesn't matter whether it's written or verbal, still a care plan. Good? Okay. So I've done an assessment. I've figured out what this patient needs. I gave you a task to do. As long as you do the task the way you've been trained to do, according to all these principles that we're going to learn, okay, and you report everything back to me, I'm happy taking the liability for this. And let me explain to you why. This patient is going to need to eat at some point while she's here. She's also going to need to pee at some point while she's here. She's probably going to get cold and want a blanket at some point while she's here. She's going to need her teeth brushed. She's going to need some clean clothes. She's going to need her bed changed. She's going to have all this stuff to do at some point while she's here. Now, if she's calling me for all of those things, I'm going to get none of my work done. I'm not going to be able to assess another patient that just came in. I'm not going to be able to handle a reassessment of a problem that came up. I'm not going to be able to start IVs, which is not something anybody else can do. I'm not going to be able to review the lab work for critical values, which is something nobody else can do. I'm not going to be able to coordinate with pharmacy or go pick up the blood that I need to give a transfusion. I'm not going to be able to do all those things that only the nurse can do if I'm busy pouring her a cup of water. So what I need is somebody that can pour her a cup of water. And you look like a good person for the job. But I want you to follow my instructions. Hey, this patient is on thickened liquid. So if you give her water, make sure it's thickened. As long as you follow my instructions, I'm going to absorb the liability. Right. Now, if you take it upon yourself to do something I did not instruct you to, like get this patient out and walk them to the bathroom. Did I say anything about that earlier? No. So you decide the patient has to go to the bathroom. You decide, oh, I'll just take them to the bathroom. That was not on the care plan. Are you helping me? No, you are not helping me. Because that patient, for whatever reason, was not supposed to get out of bed. It wasn't on the care plan. You added to the care plan. Do you think I'm going to take responsibility for that? Absolutely not. So the nurse absorbs the liability as long as you are following their instructions. You guys see that? Everybody got that? So the liability as a CNA is protected as long as you're under the care plan. Any questions on that? Okay. That should not be there. So when you look down here on the bottom of page 15, you'll see our scope of practice defines what we're allowed to do. Delegation is going to assign those tasks to us. And as long as we're in our scope of practice, following the care plan, We don't have liability. If you're outside of that, you do. This is why you really need to be in communication with your nurse, because they're accepting the liability for what you're doing. So let's go back to X's question earlier. You guys remember X's question? There was a rash or a red area, new marks or redness, but they said it's fine or normal. Who has the liability there? The nurse, that's right, because this person did what they were supposed to do. They made an observation and they notified the nurse. The nurse said it's fine. Is this person liable? No. They followed the process. Thank you. So, should you document it? Well, it really depends on your facility and the documentation. I probably would report it up the chain of command if I had a concern, but there's no liability there. Any questions on that? Did that help you?
Yeah, it kind of sucks not having liability though. It kind of like make you feel bad, like you like concerned about the red marks, nothing being done. That's probably like the worst thing in CNA.
That is the worst, yes. So let's talk about that really quickly. I wish I could tell you, I really do. Gosh, I really wish I could tell you that every nurse you work with is going to be a good nurse. I really wish I could say that. I'm an old nurse. I have been a nurse for over 35 years. I'm an old nurse. Nursing has changed a lot in the time that I have been a nurse. Not all for the better. I'll just say that, not all for the better. Now, that doesn't mean that all the nurses out there are not in it for the right reasons. There are still a lot of very compassionate, empathetic, caring, wonderful nurses, but there's also a lot that tend to dismiss CNAs. You guys are the reason that I'm able to be a nurse. Otherwise, I would be giving the water and the blankets and the toileting and the mouth care and all of those things, and I wouldn't have time to do the nursing things, right? So you guys are an important part of the team. Even more importantly, you spend more time with the patients than I do. So you're the ones that are going to tell me if there's new marks or redness. Yeah, so you are such a big part of the team, and I really believe you should be paid better. I do. We'll get into that a little bit later, why you're not. But I do believe you should be paid better. You are a big part of the team. But that is the sad reality. Bless you. That is the sad reality out there. And if you are finding that you're working with a nurse that does not seem to have the patient's best interests at heart, you do need to go up your chain of command. You do. It'll be your shift supervisor. Whenever you go to work anywhere, they give you basically a chain of command. You start with your shift supervisor, and then maybe your floor manager, and then the assistant DON, and then the DON, and then the administrator. There's a whole chain of command there. You wouldn't want to just walk into the administrator's office and say, hey, you got to follow your chain of command. Okay. So, and this is going to vary depending on where you work too, the command structure where you work. But let's talk just a minute about different facilities and different types of care that you might be asked to perform. Okay. So let's say that, what's your name? Way back there. Sheila. Okay. And what's your name? Mackenzie. All right. So Sheila and Mackenzie go to work at a rehab center after they graduate here. You guys are brand new. Rehab center. I'm sorry, not a same-day surgery center. So you're going to work in the post-op section. So these patients have had surgery, they're getting ready to go home, and you're just making sure that they're able to pee and that they have their belongings and that they understand their follow-up requirements. And we're going to give you a new skill, but hold up a minute and I'll explain in a minute. You're going to work in the pre-op section. So you get them fresh-faced, 5 o'clock in the morning, ready for surgery, and you've got some things that you have to do to get them ready for surgery, okay? So you're going to have, both of you are going to have some new skills to learn based on this new setting. Fair? But they're not going to be the same skills. You're in pre-op. Those patients need a catheter before they go into surgery. Now, CNAs legally do not put catheters in. Okay? Now, some settings you can. Remember that whole delegation thing, right? The nurse has to look at the state laws and the facility requirements and all that. But for the most part, CNAs are not putting catheters in. However, there are some settings where CNAs can take them out, especially if it's a routine task on a stable patient that's getting ready to go home. That's about as stable as you can get. They're going home in like 20 minutes. That's pretty stable. So I can train you to take a catheter out. Then they have to pee before they go. So you are not going to be trained to put a catheter in. You might be trained to take a catheter out. Do you guys see how the type of patient is the same, but the tasks are going to be a little bit different depending on where that patient is going? Good? Does that make sense? Does that make sense? If you're uncomfortable with the task, you just tell them, hey, I'm not comfortable with that. Just not comfortable. But it is in your best interest. It makes you much more employable when you have extra skills under your belt. And if you can get free training, that's a good thing, right? So keep that in mind. Let's talk about the test. Let's talk about the test. So this is on page 12. I have a video for you. I'm not going to make you watch it here. I show you very few videos. I have a lot of them. All of these videos were made in-house by me. So I don't know if you recognize that on the video that we saw earlier. It is my voice. I do that because I'm already talking so much. At least the video can help a little bit with that. But those videos are available on my website for anybody to watch at any time, so you have the ability to go back and rewatch them. You'll get a link to that video in the wrap-up emails today. Now, I have this one too. How does the CNA exam work? I'm not going to show you this video. It is available on my website if you wish to watch it. All of my lessons have a video that goes along with it. Most of them are in animated form. I do all of the graphics in-house. I do all the video editing. I do the sound work. So everything that's in these videos are done by me specifically, so I can make sure that you are getting the right information. I'll never contradict myself. Okay? So these are all of the notes for what we're about to talk about. Let's talk about testing day. On testing day, our closest testing center is down in Tampa. There are others. There are lots of testing centers throughout the state of Florida, but our closest is in Tampa. We used to have one here in Spring Hill. In fact, I ran it. It was right down the road, attached to the scrub shop. We probably about 7 years ago, they moved it to a larger metropolitan area, and then that one closed, and now we're kind of stuck with Tampa. That's our closest one. They test 8 people a day. 8 people a day. And they test 7 days a week. So you might get a Sunday test date. They only take off major holidays. So 4th of July, Labor Day, Memorial Day, Thanksgiving, Christmas, New Year's. I think that's it. So you might actually be testing on Mother's Day or Father's Day. They test 7 days a week. And that's because there's such a high volume of applicants they've got to get through. Now, when we go to the testing center on testing day, and I'll give you all of the particulars on class 4, we go through the test registration on class 4. I explain the whole process then. I'm going to give you a brief overview today. So when we go to the testing center, you'll be there with 7 strangers. You will not be testing with the people in this room. Everybody is going to register independently. You will be tested independently. You will not be testing with the people in this room. So you're there with 7 strangers. When you go, the only things you can take into the center with you is your test admission letter, your keys, and your 2 forms of ID. You cannot take any electronic devices in or study material. So if you have your car outside, leave your cell phone in your car. If you are getting dropped off or taking public transportation, they are going to lock your cell phone up in a locker, and you won't get it back until the end of day. So when you go, you're going to be checked in. Now, we're going to talk about that whole process on class 4, but briefly, when they check you in, they need to make sure that you are actually you and you are not testing for your sister. So they take this very seriously. You have to have 2 forms of ID, and the name has to match on both. And it has to look like you. So they're going to check you in. Once they're convinced that you are you, and by the way, yes, they have had episodes where people have committed fraud. There's a lady down in Miami that was making like $700, $500 a pop, something like that. She would go take the test for people. Crazy. Crazy. So they take this seriously, right? Can you imagine? Can you imagine being a patient and having a CNA that never took a class, that never passed a test, that has had nobody validate their skills? Those are the people that put our patients at risk. So we take this pretty seriously. So when you go in and they check you in, they're going to put you in a waiting room. Now, off of the waiting room are going to be 2 other rooms. One of them is a computer room where you're going to take a 60-question multiple choice test. The second room is your clinical skills room. But when you get into that waiting room and they check you in, they're going to ask you a couple of questions. And one of the questions they ask you is, do you have any physical ailments that would prevent you from being a patient for any one of the skills that are going to be demonstrated today? Because when you go to test, you're not just performing skills, you're going to be the patient for somebody else to perform their skills on. So they're going to ask you, do you have anything? So if you just had dental surgery, you need to let him know, because I don't want you to brush his teeth if he just, had dental surgery, because that could cause problems. If you've got a sprained ankle, we need to know about it. If you've got athlete's foot on your feet, we need to know about it. Just anything that you have that would prevent you from being a patient, you would want to report it. And I've got some really funny stories to tell you a little bit later on about that. But they will check you in, and then those evaluators are going to go away for about 20 to 30 minutes. Now, you're sitting there with 7 strangers, and your test or your anxiety level is this high because it's a test. Don't make friends on testing day. Don't. Sit there quietly, keep to yourself. You can talk about the weather, that's fine. You can talk about current events, that's fine. Do not talk about the test. And the reason is this. This is how it goes. In every waiting room, every testing day, I could tell you a million stories, but it goes something like this, right? You got 8 people sitting around, and somebody's going to say, oh my gosh, I'm so nervous. I really, really have to pass this test. I don't want to fail. This is my 2nd attempt. I'm so scared. And you're probably going to ask, well, what did you fail last time? I failed hand washing. I couldn't remember how many paper towels to use, and I failed hand washing. And you're going to go, how many paper towels to use? They count them? And now you're like stressing out, right? Because your teacher did not tell you anything about counting paper towels. And you're sitting there going, what don't I know? They didn't fail because they didn't count paper towels right, by the way. That was their interpretation of why they failed. But the problem is that as you're sitting there, the stress level is going to go up. And you might say something like, well, my school said that paper towels don't matter. And then somebody else is going to chime in and go, oh, well, my teacher says it does. And we have to use 4 paper towels. And somebody else is going to go, 4? I was told 10. So now in like 2 minutes, you have completely derailed 8 people because everybody is now trying to figure out how many paper towels you're going to need to wash hands. And it's very, very stressful. So if you try to be the good guy and go, listen, it doesn't matter how many paper towels, you're good. And that person goes to test and they fail. Who do you think they're going to blame? The last person that gave them information. You don't know why they failed, but if they failed, they're going to blame you. Probably had nothing to do with what you told them, but they're going to blame you. Don't make friends on testing day. Be nice, but don't make friends. Don't get involved in those conversations. After testing day, go teach the world. Everybody needs these skills. Everybody. Teach the world, but not on testing day. You guys will probably get celebrity status too, by the way. You will. When they find out that you actually sat in Miss Patty, the one from YouTube, that one, you sat in her class, you'll get celebrity status. It's crazy. Guys, I'm at 35 million views. We are the #1 channel. Every school uses my videos. Every school in the country uses my videos. So when they find out that you studied with me, you'll become a celebrity. It's pretty cool. But don't try to teach on testing day. Okay, good, fair? All right. So you're going to be sitting in this waiting room for about 20 to 30 minutes, and you're going to be scratching your head like, what is taking so long? Well, what they're doing, what those evaluators are doing are pairing you up, and it's not random. It's actually very scientific the way it has to be done. So this takes some time. Remember, you have to report things that, you can't be a patient for, right? So let's say that you have a milk allergy. We can't feed you. You had some dental work done. You're out for feeding, denture care, and mouth care. We can't use you. And you have a transfer from bed to wheelchair. Now, she is, and I know what skills she has, by the way, because they're coded into your Prometric ID number. So as the evaluators are looking at your ID number, they know exactly what skill sets you guys have. So if you were going to transfer somebody, I have to pair you up with somebody your body size or smaller. That kind of limits, right? So I'm probably going to pick on you way back in the blue. Okay. So I'm going to try to pair you guys up, right? But she reported that she just had some dental work done and one of your skills is mouth care. So I can't pair you guys up. So now I'm back to the drawing board trying to find the net, so now it's probably going to be you, right? So this takes some time for those evaluators to meet all of the criteria to match you guys up for skills. Does that make sense? So you don't want to make this any harder on the evaluators than you need to. If you have not had dental surgery, do not tell them that you have just because you don't want anybody brushing your teeth. If you do not have athlete's foot, don't make it up so that nobody has to clean your feet because you got a foot thing, right? Don't make this harder on the evaluators. Does that make sense? Once they have you paired up, so we've got 8 people here, and they pair you up into groups of 2. Remember, this is not random. They're going to assign you groups. So you guys are group 1, don't go anywhere. You guys are group 2. Did you need me? Okay. Stick around. You'll have about 45 minutes before you have to be in, but you can go out to your car and study if you want to. You don't have to stay in the room. Okay, but be back in about 45 minutes. You guys are group 3. You've got about an hour and a half to kill. So, go find something to do. Go get a cup of coffee or something. You guys are group 4. You've got about 2.5 hours to kill. So Chili's 2 for 1 margaritas. We'll see you in a little bit. So you guys are going to be brought in, right? So we've got our groups. You 2 are going to be brought into the testing room. Now, the testing room is small. It's like the size of a patient room. And it's private. It has walls and a door. So all of you guys out there cannot see what's happening in here. They're going to take you into that testing room. And they're going to show you around because you have no idea where anything is. You've never been there before. So they're going to show you where the 3-drawer bedside unit is. They're going to show you what they use for a privacy curtain. And by the way, for the test, the privacy curtain is not going to go all the way around the bed. They need to see, bless you, they need to see what you're doing. So the privacy curtain is only going to come out about 4 feet like this. Okay, so don't expect it to go all the way around the bed. But they'll show you how to demonstrate the privacy curtain. They're going to show you how the bed works. If you have wheelchair, they're going to show you how the wheelchair works at that setting. They're going to show you around, give you a little mini orientation, show you where the supplies are and everything. And then they're going to pick one of you 2 to go first. So can you give me a number 1 to 11? Oh, look at that. Good job. So you're going to go first, and this is your skill set. The evaluator is going to read it to, we can't even trust that you know how to read, by the way. We're going to read it to you. So your 3 skills are feeding the resident who's in a chair, and they'll read the care plan. Perform passive range of motion to elbow and wrist, and they'll read the care plan. And assist resident needing to use a bedpan, and they'll read the care plan. And then they're going to hand it to you. And that is yours for the entire time that you test. Now, you need to do those 3 skills in the order listed. So 1, 2, 3, exactly the way they're listed. And if for some reason you can't remember what the care plan said, just go read it. That is yours throughout the entire test. Now, you're going to do your 3 skills on her, and she is going to get a script to follow. It's going to tell her what to say, what to do. So you're not improvising. And when you are the patient, you are going to be you. Pleasant, cooperative, and you. You aren't turning into a 90-year-old invalid. If the skill is ambulate, you're going to walk like you walk. You are going to be you. Pleasant, cooperative. Now, those of you who have family or friends or loved ones at home that are going to practice on them during class. Anybody have somebody you're going to practice on at home? You should. It will help you. Your homework tonight is to go home and find whoever it is that you're going to be practicing on, and you're going to tell them, my teacher said that when I'm practicing on you, you are not allowed to make it hard. You are going to be you, not a 90-year-old version of you. Okay, because that's what happens. When you go home and you start practicing on people, they're going to try to make it hard. They're going to drool, or they're going to spit, or they're going to try to collapse, or whatever. They do crazy stuff. That is not what the test is about. Tell them, don't do it. Because they're not helping you. They're being dramatic. Okay. All right. So you get your 3 skills. You do them on her. She gets a script. Then she gets her 3 skills. It's going to be read. You get the care plan. You'll do them on her. You guys go out. You're done testing. You guys are brought in. You'll do your skills on her. She'll do hers on you. You go back out to the waiting room. You guys come in. You'll do your skills on him. He'll do his on you. You go back out to the waiting room. You guys stumble in from Chili's. You're feeling great. You'll do your skills on him. He'll do his on you. You'll go back out to the waiting room. After all the skills are done, then everybody goes into the computer room and you take a 60-question multiple choice test on the computer. At the end of the day, once you've done the skills and the written, you will get your reports, your test results. You will find out that day whether you passed. Okay. Good. So this is going to show you how all of that works now that I gave you an overview. So the evaluator is just the three of you in this room. The evaluator gives the first person testing the care plan, reads it to them. They then hold it. They're going to put it somewhere that they can access it. And then the second person will become the patient. Good? Everybody good with this? On the back, can you turn that over and hold it up for me? On the back are the actual testing checklists. This is what Prometric is going to use to determine whether you pass or not. These are all public. Everybody can access them. So not only do I know what the care plan says, I know what the checkpoints say. Thank you. So I'm going to make sure that you get all of those checked off. Because for me, good enough is not good enough. If I'm the body in the bed, I don't want a good enough CNA. I want a CNA that's going to protect my butt from being shown as they turn me over. I want a CNA that cares and doesn't leave my face covered in toothpaste after mouth care. Good enough is not good enough. Not to me. Not when I'm the patient. So I'm going to make sure that you get all of those checked off easily. All right, so we're going to take a quick break, and when we get back, we're going to talk about skills grading, how they're going to use these checklists to determine whether you pass. And then I'm going to show you how we're going to get all of those things checked off easily. So we're going to go ahead and take a break, come back in 15 minutes, 33. And remember, there's coffee and soda and bathroom and water and all kinds of stuff back there. And we're back. Okay. Everybody good? All right, let's talk about how the skills are going to be graded. Remember, there's two parts to the test. There's a written test and there's a skills component. So the skills, you'll demonstrate 3 skills on another testing student as your patient and be graded through a checklist. The written test is 60 questions, multiple choice. Guys, I'm going to tell you the written test is not hard. It's not. By the time I'm done with you, the written test will pretty much take care of itself, and I've got some resources to help you out with that as well. A lot of it has to do with your scope of practice. And I do a free game show on the 1st and 3rd Tuesday of every single month. Keep that up for a minute. Tomorrow, I'll be doing the game show for this new session. Is it tomorrow? No, maybe not.
It'll be the following Tuesday because you just did one this past Tuesday.
Yeah, the following Tuesday. And it's going to be 15 questions. You compete for real prizes. We give away card games and badge holders and t-shirts and all kinds of stuff that you can compete for. But it gives you a really good idea of what to expect on the written part of the state exam. I go through 15 questions and I actually explain why the right answer is the right answer for each one of them. So that's on our YouTube channel. Amelia says, good morning, Nurse Patty. I passed my New York CNA exams last week. Oh, congratulations. Great job. I love those. Thank you, Jake. All right, so the written test is not hard. The skills test is much more challenging because it's a physical test. You have to demonstrate. And there's lots of checkpoints that we have to get. And some of these have lots and lots and lots of checkpoints. Can you hand that to me, the yellow? Thanks. So you can see how many checkpoints. There's a lot of checkpoints for each one of those 3 skills. So we have to have a logical way of learning these skills that makes it easy to get all of those checked off. Okay, good. So when you're taking the test, they have a checklist like this that they're going to use to grade you with. Now, these are not subjective. These are very concrete. So there's not a lot of wiggle room here. Either you did it or you didn't. It's not wishy-washy. Does that make sense? Okay, they're concrete. So when you do a step, you get a check mark. When you don't do a step, you completely missed it, it wasn't done, no check mark. If you do the step incorrectly, no check mark. So the only way to get a check mark is to do the step correctly. Okay, good? Make sense? Anything without a check mark is called a deficiency. That's what they're called, deficiency. Now, when you're taking the test, the whole goal is to get as many check marks as you can. Anything without a check mark is going to count against you. And a lot of people, the next question is, well, how many things can I miss and still pass? Everybody wants to know that, and I can't give you that answer because each of these checkpoints are weighted. Now, this they don't publish, okay? They don't tell us how these things are weighted. We do know they're weighted, yes, but they don't tell us how. And let me give you an example. Let's say that we're going to brush her teeth. Okay. Care plan told us to provide mouth care. Is she in a safe position for mouth care? No. Why? Okay, she's laying down. She can choke. That's right. So that's kind of important, do you think? We need to get her sitting up. Somehow, it might be sitting on the side of the bed. It might be head of the bed up, but we need her upright to do mouth care. So we know that's a step that we're going to have to take. It's a checkpoint. Now, think about you brushing your teeth. When you're brushing your teeth at your house in the morning, you probably lean over the sink like this a little bit, right? We brush. We want to lean over the sink because we end up being a big goopy mess when we're brushing our teeth, and that stuff has to fall. And we don't want it to fall on us, so we tend to lean forward a little bit. Sound fair? Okay. Your patient in bed, not going to be leaning forward. They're just sitting up. That means that all the stuff from their mouth is going to fall here. What could we put to help protect their clothing? Napkin, a bib, a towel, a cloth, something. Yeah, we don't want toothpaste all over their clothes. We're going to have to protect it somehow. Make sense? Towel's probably best because then we can dry their mouth afterwards. Towel would be best. Okay, so we know that we have to put the head of the bed up, and we know we have to cover their chest. Those are 2 checkpoints. But let's think about the importance of each one of those checkpoints. Has anybody ever died from getting toothpaste on their clothing? No. Has anyone ever died from aspiration or getting fluid into their lungs? So those 2 are not equal. If you don't put the head of the bed up, your patient can aspirate. They could die. If you don't put a towel over their chest, their clothes are going to get dirty, but nobody dies. Those are not weighted equally. Do you see that? Okay. So I can't tell you what weight each step has. But along the way, I am going to tell you when certain steps have a additional weight to them. Things that we want to make sure we're absolutely doing, like putting the head of the bed up. Good? Make sense? Good? All right. So the best thing to do is to get everything checked off, and then we don't have to worry about what's counting against us because we got 100%, and that's ideal. But if we do miss 1 or 2 or more steps, remember that they're not all going to count equally against us. In some skills, missing 1 step would fail you. In other skills, missing 6 smaller steps, you might still pass. It's not a matter of number of steps. It's a matter of importance of steps. Does that make sense? Okay. All right. So after you take your clinical test, you're going to go to the computer room and take a 60-question multiple choice test on the computer. Again, not hard, not hard. I have a resource here for you. This is an ebook. You'll get this in your wrap-up email today. Like I say, you don't even have to take notes. It'll give you the link. It's 4YourCNA.com/ebook. Sign up for this. It'll come to your email. You'll download it. It's workbook style. Everything I do is interactive because it's how you learn. This is what it looks like. This is a physical copy. This is my only physical copy. It's digital, what you're going to download. But this is what it looks like. It's small. It's really easy to go through. But it's going to help you understand the way those written questions are worded, because it can be tricky. And what they're actually asking with each one of those questions is one of 5 categories. So we'll go over that in the ebook. And I'll explain it a little bit more as we go through. So there's a lot of activities in there to help you understand how that written test is going to work as well. So at the end of the test, when you're all done, they are going to give you your test results. You'll get a page that looks like this. And hopefully at the top it says, congratulations, you passed. That's what we want. This is for the written test. Actually, I'm sorry. I got these in the wrong order. Here it is. This one's for the written test. Here, it tells you the category that the question was in, how many questions were in that category, and how many you got right. At the very end of the class, on the last day, I'm going to tell you about a practice test that you guys have access to. And if you miss less than 5 on my practice test, you will pass the written test. I've never had a student that missed less than 5 on my practice test fail the written test. So the practice test is very, very accurate as far as how you're going to do. Okay? But we don't want to get into that yet because this is only class 1. I still have a lot to teach you before you take a practice test. Good? All right. You'll also get a page that looks like this. And that's this one. This is your results from the skills. Up here, hopefully, it'll say, congratulations, you passed. Down here, it's going to indicate the skills that you had, the actual skills that you were assigned. It'll go on to the next page. And then you'll get a page that looks like this. This is the feedback. All of those deficiencies, right, all the things without a check mark is going to show up here. That's what they put into the computer. That's what the computer decides whether you're going to be a CNA or not from.
I have a quick question of like, since I know it's 2 different tests, if you say you passed like
Yep.
the skills or you passed the written,
Mhm.
but then you missed the skills and you have to retake, will they make you retake both?
No, that's a very good question. So you only have to repeat the section that you failed. So if you pass the written, it stands for 2 years. You've got 3 attempts to pass both sections in a 2-year period. So if you fail and you wait 2 years, everything resets and you can try again. But you should be okay. You should be okay. If you have to retest, if you fail, I want you to email me because we're going to figure out why. Okay. We're going to figure out why. Guys, like I said, I've been teaching this now for a very long time. I've got this so dialed in that if you do everything in this class, if you just follow the trail that I'm leading you on, you won't fail. You can't fail. You're trust me, you guys haven't even seen everything that I've got that you guys are going to have access to. If you do the steps that I tell you to do, now part of that is on you. Of course, you have to do the steps, right? But if you do it, you will pass. You will. I have so much confidence in this, not based on me, based on the results that I get. Okay. We have, it's not a boast, guys. This isn't a boast, but 35 or 37 million, I don't even know what I'm at, 35 or 37 million views. Everybody that takes a test has watched our videos, right? You guys didn't need to come sit in this classroom to take the test. Anybody in Florida can go take the test. You can challenge the test. I even have a video that tells you how to challenge the test. You can watch this live stream for free. There are people on right now that did not have the money to take this class, so they're watching us for free. Hi, and they're getting the exact same information you're getting sitting in these chairs. And they're asking questions. Okay. We have a huge amount of people, and you'll see it as we go through the program. They're going to come in and they're going to tell me, hey, I just watched your videos on YouTube and I passed the test. So 2 comments today on YouTube alone. So you have to understand that you guys are sitting in a classroom. You guys are getting above and beyond what they got. All they did is watch some of my videos and they passed the test. You guys have me in here. All of these on-screen graphics. You have the book. You're going to have the online course after class today. You've got so many resources, the ebook, you got so much. There's no reason you should fail. If you could just watch some videos and pass, I'm going to throw all this other stuff at you too. That's insurance. Good? Does that make sense? I'm glad you guys are all here, by the way. But remember that I love watching your videos. I understand so much better. Thank you, Jackie. We're well known out there, and I do a good job at explaining this in a way that makes sense. I don't like to complicate anything. I like to simplify everything. Yeah. So, but if you're having an off day, it does happen. If you're having an off day and you fail one portion, you only have to go back and retake that portion. Now, I will say timeout. Where some of you are going to have a problem is if English is not your first language, that can cause some issues, especially with a written test. Because you're reading it, your brain has to translate it, and then you got to come up with an answer and translate that, right? So you can kind of lose some stuff in translation. So if English is not your first language, it could be a little bit trickier, but you should still be okay. All right, so you get these results and you get this feedback. Now, on the feedback, something I did not tell you earlier, and the reason is because I'm not sure how the test is structured right now. We did have 2 RN evaluators in Florida for the last 5 years or so. We've had 2 evaluators in the room in Florida. Florida is the only state that has 2 evaluators. The last 2 to 3 months, the feedback I'm getting from students and from teachers, because I do a lot of instructor support with teachers, they're back down to 1 evaluator. Now, the reason that they had 2 evaluators was for you, not them. Because a lot of times students, there was a lot of complaints. A lot of times students would call up Prometric and say, hold up, the evaluator has on here that I didn't do a step and I did it. I absolutely did it. And they were getting a lot of those feedbacks. So, sometimes the evaluators may not see everything that you do, or they may just be having an off day. But that affects your score, and that's not fair, is it? Right? So in order to fix that, about 5 years ago, Prometric put a second evaluator in every room. And if something was only listed once as a deficiency, that means one person saw it, one person didn't see it. The second person wasn't paying attention if the first one saw it. So it wouldn't count against you. Does that make sense? Okay. So if you have 2 evaluators and you see something listed twice, that means that it counted against you. Both of those evaluators said you failed to do this step. If you have 2 evaluators and something is only listed once, it did not count against you. Now, if you only have 1 evaluator, I'm going to give you a technique that you have to use as we go through the program. And you guys are the first class that I'm really stressing this on again. If you only have 1 RN in that room while you're testing, it is imperative that you say every step out loud. Because that evaluator has to pay attention to this. They have to check these off. So if the evaluator is standing there with their pen and the checklist and they're looking for a checkpoint when you do a step, they may not see you do that step because they're looking here, not there. But if you say every step out loud, they can hear it. So 1 evaluator, you need to talk. 2 evaluators, you should still say all your steps. But it's imperative with 1 evaluator. Does that make sense? Good? Okay. All right. So this class that I'm teaching you has evolved over the years. My knowledge of the test has evolved over the years. 5 years ago, actually 2 years ago, we didn't have all these slides. I just stood in front of the class and talked. So this is I created all these. You're going to see 1,300 slides in this class, and you could get to go back and review them. 1,300 slides. I added on over 600 slides this week. And I do this for you, not for me. I have literally sat in front of my computer for 15 hours a day for the last 7 days trying to get this done for you guys. I do this for you. It's evolved, okay? But one of the things, as I have been evolving this program, one of the things I learned early on, long time ago, was if they're going to grade us on these checklists, we probably need to know what the checklist says. The problem is that this checklist is written for an evaluator, for an RN. This checklist is not written for you. It's written for an RN. So how do we get this checklist to you in a way that makes sense to you? Well, you have me translate it into student. So these checklists are RN checklists. This RN translated it into student. So you're in your book, we're going to see this in a few minutes. You're going to have step-by-step instructions for every single skill that is based on these checklists. Exactly. But in order for me to do that, in order for me to write this book and do that, I had to deep dive into these checklists. And now I know them. I can recite these checklists to you verbatim, because I have made this my mission over the last 15 years. As I started to learn it, though, what stood out to me, what I started paying attention to is, hold up, there's 20 skills. And the first line of every skill is exactly the same. Exactly the same. The first line of every skill says, did you, the candidate, greet the resident, address them by name, and introduce yourself? So you have to do that. Now, what makes it worse is all 3 of those things are on one line. So in order to get that check mark, you have to get all 3 of those things. You have to greet the resident, you have to address them by name, and you have to introduce yourself. If you don't do one of those, you don't get credit for any of them. Okay, keep that in mind. Then I went on a little bit and I said, well, wait a minute. The second checkpoint is the same for every single skill. Doesn't matter what the skill is, this is always the same. Did you provide explanations of care before and during care to the patient? So did you tell them what you were going to do? So some of you are going to ask, do you have to talk through this skill? Do you have to say to the patient everything that you say? Yeah, you do, because your patient doesn't know what you're going to be doing with them. You have to provide explanations. The checkpoint says you have to provide explanations. Good. Now, you don't have to say it exactly the way I say it. You can put it in your own words, but you do have to talk to them. We also, as I was going through, realized that there's a checkpoint on every single skill that says, refrain from touching resident until hands are clean. So let's stop there for a second, because You guys are probably, during the course of the class, you'll probably go onto YouTube and you'll type in how to insert name of skill here, right? And it's going to bring you to my videos, but it'll also bring you to other videos. And that's fine. You can watch the other videos. But you have to know what the checkpoints say to figure out if those videos are accurate. And this checkpoint says refrain from touching resident until hands are clean. Now, a lot of those other videos have the student coming in, and let me look at your ID band. I'm touching the resident. That means I'm not getting that checkpoint. Do you guys see that? So in order to be able to tell whether the resources you're using are correct, you have to know the checklists. And you guys all have access to these. Good? Makes sense? There's more. In fact, about 40% of all skills are exactly the same. About 40% of every single skill is exactly the same. You see all the red and green? You see all the red and green? You see all the red and green? You guys see that? The green is the opening and the red is the closing. This is how we start every skill and how we end every skill. So every skill requires that we leave the call light in or near the resident's hand at the end of the skill. Every skill requires that we ask the resident about their comfort. Every skill. So what I did many years ago is I looked at all of these similarities and I thought, well, it would be easier if I taught the students all of the similarities and then we went back and just kind of filled in the gaps, you know, the things that are specific to the skill. If 40% of every skill is exactly the same, let's start there. Let's learn the part that's the same for everything. Good? That's how this program was born. And that's what we're going to learn are the principles. So the first principle that we're going to learn is the opening. The opening. And we're going to get to this in a few minutes, but this will be the first principle that we're learning. And remember, this is formed by all of those checkpoints that are exactly the same on every skill. So if it's on here, it's a checkpoint. And we're going to see that in just a few minutes. Okay. So this is what I just showed you. You can see that on almost every skill, this one's probably about 50%. So this is where students kind of go wrong. And this is why I've had to change my program over the years. Because I noticed years ago, I would teach this, but I really didn't stress it. And students, when they were practicing, they would skip, they would go straight to the skill. Like they would actually start brushing teeth. They would just go straight to the skill. And I'd say, well, you have to do your opening. And they go, yeah, I'll do that during the test, but I just want to practice the skill itself. No, the skill itself includes the opening. Mouth care isn't mouth care without the opening. So when you're practicing, you need to practice with the opening and the closing. The skill isn't over until it's over. Does that make sense? Because the way that you practice is the way you will perform. This is called the Big Four. This is where we're going to start learning the principles. This is the Big Four. Skill rules, we already know. We follow the care plan, the whole care plan, and nothing but the care plan. We observe and report those observations to the nurse. We already know this one. We're going to learn this one and this one today. This will be the first thing we learn Wednesday. These are what's going to make up 40% of every skill. You can see them all in your book, all of those banners on the back wall on page 27. But you'll know them very well by the time I'm done with you. Here's a brief sales pitch. I used to not bring this up in class, but then students would get mad because they didn't even know these were available. So all of these principles that we're going to be learning are on flashcards. Flashcards are right up here. You can see them here. These are the flashcards. It has all of the principles detailed. You can make your own. Get some flashcards. Write them out. Make your own. You could also buy them from me. They're normally $25. I'm giving to you for $15 while you're enrolled. So this ends on graduation day. But principles, supplies, and the steps are all on these flashcards. It makes it very easy to learn. So before we get into the actual principles, we have to talk a little bit about the patient, because that's really why we're doing this, right? Is the patient. So we have to think about the patient's experience. Now, I want you to kind of stop and think about this for a second. Patients, well, let me back up a little bit. Anybody here ever been sick? Where do you want to be when you're sick? Whose bed? Mine. I want to be home. I want to be home. In fact, if I am sick and not home, I am grumpy. Because where do I want to be? Home. That's right. There is no place like home. It is yours. You are most comfortable there. So if we have a patient in a facility, they are not home. What is that going to make their mood feel? Uncomfortable, agitated, grumpy. Absolutely. Absolutely. And we have to keep that in mind. Your patient is not having their best day. Now, it gets worse. Patients in a facility all think they're dying. Just ask them. They'll tell you. They are scared to death because if they are sick enough to not be home, that means this is something pretty serious. And I'm afraid that I'm about to die. So they are very self-absorbed. Do you think they're going to be listening to everything you say? They're self-absorbed. Anybody here ever been a patient in a hospital? When you're sick, you need rest. Do you know the worst place in the world to try to get some rest? Oh my gosh, in a hospital, somebody comes in on average every 17 minutes. 17 minutes. From the doctors to the nurses to the CNAs to the x-ray techs to the phlebotomists to the billing people, and man, they hurt. Discharge planners, transporters, social workers. I mean, there are a million people in and out of that room, and you're not getting any rest. What do you think sleep deprivation does to a mood? Oh, yeah. If you thought you were grumpy before, you are really grumpy now. Now, on top of that, we have to consider the fact that our patients, not home, but their loved ones probably are. Because the patient is going to be alone in the facility quite a bit. We have visiting hours. We don't let people come in and camp out. So you are in a strange place surrounded by strange people that you do not know. Are you starting to see that your patient is not having the best day of their life?
Me and my family, we take care of my grandmother that has dementia, and every time she does go to the hospital, like she never eats while she's there. We have to like bring food from home.
Yep.
To give her to eat. And
Yeah.
when she comes home, it's hard to get her like
Reacclimated.
because she's so like amped up and she's like been so uncomfortable like in the hospital. And we take care of her full time.
Yeah. Well, bless you for that. That's quite an accomplishment. But yes, Anytime, especially with dementia, the problem with dementia is that dementia is fine on its own. It's when people have to cope, right? If there's any change in your life, you have to cope. Any change. Could be the weather, could be the lighting, could be not enough sleep, could be that you're hungry. But if there's a change in your life, you have to adjust to that change. Well, that's the big thing with dementia, is that you can't adjust very easily, and that can set you off, right? Well, hospitals, nothing but change. There isn't anything normal about that. So yeah, they get patients in dementia patients in a hospital. It's hard because it's all change, and they have no coping mechanisms for that. Yeah. So very, very difficult. So are we starting to see that our patients probably aren't going to be in the best frame of mind? So if we keep that in mind, if you have a good patient, that is a great day. If you have a patient that's nice and isn't biting your head off, that is a great day. Don't expect that from your patients. Expect this. Does that make sense? Expect this. Now, we hope that they're nice, but they're probably not going to be, because they're sleep deprived, they're scared, they're worried, they're getting a big bill. How is this going to affect my ability to work? Who's feeding my cat? Right? All of these things are going on, and it's a very stressful time in their life. So if they're nice, that's a great day. The maddest I've ever gotten at a CNA that I worked with was a CNA who said the words to me while she started it. Excuse me? That patient has the right to act any way they want to. They are the ones under stress at the moment. I mean, within reason, they can't like throw things at you, but within reason. They are stressed at the moment. I am paying you to be professional. Those words, well, she started it, should never come into play in healthcare. We should expect this. Does that make sense? Adjust your expectations accordingly, and you will get along with your patients much better. If you start looking at ways to make their life easier rather than punishing them for making yours harder, you will get along with your patients much better. Make sense? Good? Okay. Patients, we have to remember, sick people have the right to act sick. They're the only ones that can get away with it. Right? They have the right to act sick. But not all of your patients are going to be the same. Patients have differences. You can't assume that all diabetic patients are the same. You can't assume that all dementia patients are the same. You can't assume that all men are the same or all women are the same. People are different, and sick people are way different. So we have to adjust our approach for every single patient that we encounter. There are some patients that I have to put my stern mommy voice on for to get them to do what I need them to do, or to get them to quit acting a certain way with me. And then there are some people that I have to turn up the charm, because usually you can get a whole lot further with patients by being nice than being mean. And there are some patients that would swear I am the sweetest person on the planet. My children would tell you otherwise.
You're here.
Exhibit A. You will have to learn to give to the patient what they need from you to get them to respond. This takes some practice. You have to learn people. And if you don't have this skill yet, remember I said the hospital may not be the right place for you just starting out. If you don't have good people reading skills, the hospital just adds a whole nother level of complexity. And it may make it very difficult for you to acclimate to healthcare in a fast-paced environment. My biggest fear is that you get into a place that's not right for you and you quit healthcare. Don't do that. If you get into a place that's not right for you, try another place. Don't leave healthcare. Does that make sense? You guys are putting a lot of time, money, and effort into this. I want you to succeed. Okay? Good. Here's probably the most common question I get in this class. What if I make a mistake? We've talked about these checklists. We've talked about the fact that we have to get all of this stuff checked off. We don't want to fail. So what if during the test I'm nervous and I make a mistake? Well, first of all, if you're not nervous, something is wrong. Something is very wrong if you are not nervous. When it comes to the test, we were testing center for many, many years, and I can't tell you the amount of times people went out in the parking lot and threw up in the parking lot because they were so nervous. I mean, that's kind of the norm, right? Not that I want you guys to throw up. That's not what I'm saying, but nervous is the norm. You're being watched performing skills. I mean, this is, talk about stress, right? This is high stress. But I want to give this to you in a little bit different perspective. Everybody's focused on the fact that, oh my gosh, they're going to be watching me during the skill. And what if I mess up and I don't do real good being watched? And, you know, I mean, it kind of ramps up. Some of you feel your anxiety going up just by me talking about it right now, right? I'm going to give you a little perspective on this. This is not the last time that you will be watched performing skills. It is the first. And in reality, this is not the one that counts. Yes, you have to pass a test to get your certification, but this is not the one that counts. When you are performing skills, that patient is going to be watching what you are doing on their body. Those family members are going to be watching what you are doing on their loved ones. And that nurse is definitely going to be watching because they hold all of the liability for what you do. This is not the last time that you are being watched. It is the first. So if you put it into perspective, the test is not something to get through. The test is for you to refine your skills to get to. Make sense? Little different perspective on this. But it kind of helps reduce some of that anxiety. Okay, good. Okay. So what if you do make a mistake? Well, on the test, you just make a correction. It's easy. When you realize that you messed something up, you say, correction, I would have whatever. Oops, I forgot to close the privacy curtain before I started the skill. Correction, I would have closed the curtain at the beginning. Oops, I forgot to scoot the patient toward me before I turned them on their side and they're too close to the edge of the bed. Correction, I need to scoot the patient toward me so they're not on the edge of the bed. It's not about being perfect. It's about being safe. You will make mistakes out there in a clinical setting. That's not a might. You will make mistakes. You're going to have so much thrown at you all at once. You got patients, you got families, you got staff, you got all kinds of stuff going on. You will make mistakes. It's all about ethics. What are you going to do when you make them? Are you going to address them, or are you going to hope that everybody else overlooks them? Well, I'll tell you what, if I'm the patient in the bed and you've got me laying on my side super close to the edge and I'm afraid I'm going to fall off, I can't overlook that, guys. Make sense? Address it. Address it. Make a correction. Most of the things you actually have to do, but some things you can correct verbally. They'll tell you. Make the correction as soon as you realize that you've made a mistake, though. Don't wait until the end. Don't try to save them all up and do it all at one time because you will forget. Remember, it's all about getting those check marks. Do it right, you get a check mark. When you make a correction, we have this list, right? You make a correction, you get a check mark. Just like you did it. It's the same check mark. This paper doesn't know whether you did the step or you corrected the step. It's the same check mark. You can go from failing a skill to passing a skill just with a few words. It's all about being accountable, not perfect. At the end of the test, or at the end of the skill, I'm sorry, at the end of the skill, you have to tell the evaluator when you are done with that skill. So remember, you have 3 skills to do, and we got to do them in order, 1, 2, 3. You're going to do skill 1, and then at the end of skill 1, you have to say, I am done with this skill before you can go on to 2. And they won't let you go on to 2 until you close this one out. And the reason is corrections. When you are in skill 1, you have up to the time you end the skill to make corrections. Those evaluators don't end that skill. You do. That way they don't take your ability to make corrections away. So you have to end each skill before moving to the next. And the reason is you're taking your ability to make corrections away. If you get all done with skill 1, all done with skill 2, and you get down to skill 3 and realize you made a mistake up here, it's too late. You can't correct it. Do you have to go fast? No. Jackie, that's a great question. We will cover that a little bit later in the program. I think it's 6, class 5, we go over that. But if you have our book, our CNA Skills Study Guide, it's on page 71. It talks about that. I have a whole lesson on that. All right. It's a good idea to reread the care plan one more time, because remember, it's all about the care plan, right? It's a good idea to reread that care plan one more time before you end your skill. Most of the time you have to do it. All right, let's go through the stack of books that are on the table in front of you. I got to move along a little quicker. All right, so the first thing you see is your syllabus. Looks like this. This is your syllabus. This is our roadmap, how we're going to get from point A to point B in 4 weeks. 8 class sessions. They go fast. So each row section is a class. So you see how that one says class 1 Monday, today, and then class 2 Wednesday. Then you have columns. So let me explain to you how this works. There's a lot of information on this page, I know. So this column tells you what skills we're going to do in class that day. And I'm pretty good at sticking to this. Now, from time to time, I may have to move some things around if I get a little long-winded somewhere. But for the most part, this is pretty accurate. This is what we're going to cover. The second section there are lessons that I have to teach you in order to understand the skills. So these two kind of go together. Good. So for instance, in here, right now, in that first column, you see skill rules. We covered skill rules. In the second column, we covered the exam, delegation, patients, testing care plans, and we'll get into the puzzle pieces in a minute. So see how we've gone through the lessons? Now that third column is a dreaded homework column. Nobody likes this column. I agree. But you'll see that for each class, you have homework reading assignments, and these are going to be in the yellow book. So tonight, you're going to go home and read chapter 1 in the yellow book. Over the weekends, you have 2 chapters. So Monday, you have 1 chapter. Wednesday, you have 2 chapters because you have a longer time to get that done. Good. Just doing the reading is not enough. You need to take a test to figure out, did you get what you needed to get from the reading? And that test is going to be in your spiral book on page 181. We'll go over this again at the end of class right before I let you go. And then this column here, additional activities, we may or may not get to in class. If we don't get to it, you probably want to do them on your own. Good? Today we got to all of it. All right, so this is your homework book. Please don't write in this book. Tonight, you're going to go home and read chapter 1 in that yellow book. Then you're going to take the test on page 181. Taking the test doesn't do you any good unless you know if you got the stuff right. So we're going to grade it with the answer key on page 201. When you come into class on Wednesday, I'm going to go right down my list. I'll call your name out and I'll ask you, how did you do on chapter 1? And you're going to tell me how many you missed. There's 20 questions. I missed 1. I missed 2. I missed none. I missed 18. Tell me how many you missed. Your grading scale is down here. I want you all to get 100 on this test. Take it as many times as you need to get 100. Because if you do that, then I know that you got the concepts. If you're telling me I missed 5 or 6, then we're going to have to figure out why. Okay, good. Now let's talk about how to use a study guide. If you look on page 52, this is how we're going to learn the skills. So if you go to page 52, this is an introduction to a skill that we're going to learn on Wednesday. And this is going to be very brief. I'm just going to kind of go through this, just a brief overview. We're going to get into this super deep on Wednesday. Okay, this is just an overview. This right here, this is the title of the skill at the top of the page. Over here are the principles that are involved in that skill. So for this one, which is pulse, we have skill rules. So we're going to follow the care plan. We're going to do our opening. We're going to figure out if we need gloves, and we're going to do our closing. Right? These are the principles involved, and they're all spelled out here for you. We have the short version at the top, just kind of your highlights of the skill. We have details, and we have a video on how to do that skill. Now at the bottom, we have test-specific information. So somebody was just asking about timing. Do we have to go fast? At the bottom here, you can see that each skill has a time associated with it, a time. So this particular skill, somebody with your level of experience, which is none, should be able to take the pulse in 5 minutes. They give you 5 minutes. Do you guys remember the care plan that we looked at earlier? How long did we have to count for? And they give you 5 minutes. That's because we have to do the opening and the closing. Well, let's take a look at how long those are. We're going to get into those in just a minute, but the opening is, hi, Ms. Jones. My name is Patty. I'm your CNA today, and I need to get your pulse. Is that okay? I'm going to close the curtain, wash my hands, and I'm back. Find the pulse, count for 1 full minute. Thank you very much, Ms. Jones. Is there anything else I can get for you? Here's your call light. If you need anything, just let me know. Environment's clean. Bed is in the low position. We're going to open that curtain, wash my hands, document, wash my hands again. Skill is done. They give you 5 minutes to do all of that. And remember, you're only counting for 1. They give you way more time than you actually need. So should you go fast? No. Take your time. So every skill that we're going to learn has a time associated with it, and they're all going to be a little different. If you look on page 25, we've seen this page before. This number in the clock, that tells you how many minutes you have to do that skill set. So they add up the time for this one, the time for this one, the time for this one, give you 3 minutes for hand washing and 5 minutes for thinking. And they come up with that number. So you got plenty of time. Slow down, guys. You're not going to time out. Page 71 talks about skills timing. Most skills are going to be done on another testing student. Some are a little too personal for that, so we'll do them on a mannequin. We have 4 mannequin skills. If you see down here a mannequin, that means that we're going to do this skill on a mannequin. When you're practicing it, please practice it on a mannequin. Okay. This area here is going to tell you where that person will be. Well, are they going to start out in a bed or in a chair for the test? This is all test info. So when you're practicing, you should set this up like the test. And then it'll tell you whether charting is required. Remember, we have 4 charting skills: feeding, drainage bag, pulse, and respirations. You will get one of those 4. If it is a charting skill, you're going to get, these are our 4 charting skills. You're going to get additional information. It'll tell you how far off you can be and still be accurate. Now let's go to the actual skills page. So if you turn to page 53, let me have my phone real quick. Hold on one second, guys. Sorry, I had to respond to that. Okay, so if you look at page 53, this is how we're going to do the actual skill itself. So at the top of the page, we have that title, just like we did on the other page. And then we have the care plan. This is the care plan from the state exam. Remember, every care plan is going to be different on every patient, but the state test, they're all the same. If you get pulse in Miami, there's your care plan. If you get pulse in Jacksonville, there's the care plan. If you get pulse in New York, there's your care plan. If you get pulse in Houston, there's your care plan. All Prometric care plans are the same. Down at the bottom, you'll see the supplies you need for that particular skill. You do have to learn your supplies. We'll get into that a little bit later. You do have to learn your supplies. Those flashcards will help you with that too. Marlene, Miss Patty, at the school I go to, they said I don't have to wash my hands because documenting. What should I do at the testing site? Wash your hands, document, and wash them again. Yeah, and we'll talk about why in just a minute. Okay, so supplies are here. You have to learn your supplies, guys. Page 37 has a listing of all of our supplies that we use. Some of them are known by a couple of different names. So page 37 is your friend to know what the aliases are. Everything in medicine has 2 names. I don't know why, but they do. Everything has 2 names. And then we have step-by-step instructions. I use this checklist to create these step-by-step instructions. If you do the skill exactly as listed, you will get every one of those checked off. And I'm going to prove it to you on Wednesday. We're going to go through and compare. Every lesson has some comprehension questions. If you can answer these, you know what you need to know. So make sure that you're answering these questions as we're learning the skills. All of you are going to be enrolled in the online course today. You'll get an email. That online course is going to help you. So in here, I'm talking. You're listening. We will have some practice time toward the end of the program, week 3 and 4. But for the most part, you're going to be practicing at home. This course helps you put into practice what you're learning. This course is interactive. One of the things that I'm going to have in this course very shortly, I don't think it'll be when you guys are still in here because I'm still working on it, interactive videos. So it'll play a clip and it's going to ask you what's the next step. What's the next step? What's the next step? So you have to guide the video by choosing the steps. So now we're going to start learning the principles. Remember, we've already learned skill rules, right? We're pretty comfortable with that, right? Okay, so now let's learn the opening. So here we have information on the opening, all the notes, and these are your details here. This is your blurb. This is what we're going to say. It's in bold right there. That is what we're going to say. So for every skill, it doesn't matter what the skill is, pick a skill. I don't care. The first thing we do is we read because that tells us what to do. And then we start the skill by using the opening. Now, during the test, you will be a little bit nervous. I get it. You will. And the worst part is trying to figure out where to start, right? When you're nervous, it's like, what do I do? What do I do? Because your brain just like flies. What do I do? So I want you to remember this. If you can't remember anything else, I want you to remember this. Every skill starts with an opening, and every opening starts with a knock. Now, we have to knock because it is a graded checkpoint. It says, did the candidate announce self or knock before entering room? You have to knock. If you don't do that, if you do the skill without the opening or closing, you've missed like half of the skill, right? This is important. But during the test, you got to know where to start. So every skill starts with an opening. Every opening starts with a knock. I teach this course in a very specific way, and I've had hundreds of students that have come back and said, oh my gosh, I heard your voice in my head during the test. I was standing there, I was scared, I didn't know what to do, and I heard you say, every skill starts with a knock. And I started there. If you can get past that, everything rolls from there, okay? Our second step is to greet the resident. Now, why do we have to do that? Because our checkpoint says we have to do that. We have to greet the resident. Now, I want to talk about greeting. Hi, hello, good morning, good afternoon, good evening, how are you? Any of those will work. Pull out your nice. Just pull out your nice. I don't care how you do it, but we have to greet the resident somehow. Okay? We're going to address them by name. This is the most accurate way of identifying somebody, is to say, what is your name? Or, I know your name is not Rebecca, okay? I know your name is not Rebecca, but if I walked up and said, hey, Rebecca, how are you today? What are you going to say? Yeah, it's not me. Every single one of you would do that. Do I have any Rebeccas in this room? No? Okay. So if I called any of you Rebecca, what are you going to tell me? Yeah, not me. Because you probably don't want what I've got in store for Rebecca. Okay. So addressing a patient by name is the single most accurate way of identifying you got the right person. Now, I know some of you are like, but hold up. What if they have dementia? What if they can't identify themselves? What if? No problem. We have a mechanism for that. Because remember, the first person is the RN that assesses the patient and comes up with and that nurse has to figure out all of those ADLs, including this. So if your patient cannot identify themselves, it would be identified by or noticed by the RN, and there would be something on to tell you how to identify this patient. So we follow and if the care plan doesn't say, we address them by name. For the test, we're going to address them by name. You don't have to go searching for an ID band. If they have one, great. They won't for the test, though. They won't. Now, why don't they grade on ID bands for the test? Because the majority of patients don't have them. We tend to think about patients in a hospital setting. Hospital setting, short term, transient. They're there, they're gone. They will have ID bands. Short term, acute care. How many of you guys live in a place, like a home, an apartment, a trailer? Okay. You live in a place. When you go to your place, do you have to put on an ID band for the people to know who you are? Why? Yeah, that you live there. Everybody that lives in that place should know the other people that are living in that place, right? You live there. Your mom doesn't need an ID band to know who you are. If a patient lives somewhere, will they have an ID band? No. Most healthcare, talking volume right here, most healthcare is given where the patient lives. A very, very small percentage of healthcare, overall healthcare, will be in a hospital or a rehab short term. Does that make sense? So when you're talking percentage, only about 15% of total patients all over have ID bands. That's why they don't have to test on them. Helen, hey Helen, can you please remind me the skills that are going to be done on the mannequin? Yeah, so dressing a mannequin with a weak arm, catheter care, peri care, and drainage bag. Those are the ones that are going to be done on the mannequin. All right, so again, why do we have to do this? Because it is a checkpoint. It's actually written there. Refrain from addressing the resident using terms other than a name, like honey. I'm not going to come in here and say, hey, sweetie. Hey, darling. Hey, dear. No, this is Mrs. Jones. Okay. We also are graded on it here, address by name. It's an actual checkpoint. So that one, hi, Mrs. Jones, gets us 3 check marks. You greeted the patient, hi. You addressed them by name, and you didn't use an endearment. 3 checkpoints with a simple, hi, Mrs. Jones. All right, you have to introduce yourself, not just by name, but by name and title. They have to know who you are. You're a stranger. Name and title. Again, it's a checkpoint. We have to describe the skill that we're going to be doing. Again, it's a checkpoint. We have to get permission from the patient. Touching a patient without their permission can be called battery, and you can be charged in healthcare by touching somebody without their permission. You can. There was a pretty famous case of that over in the other coast, like DeLand area. There was a dentist that got charged with battery by a patient. He was hurting the patient. He was trying to put some like dentures or something in, fit in her mouth, and he was hurting her, and she kept saying, stop, stop, stop. There was a piece on it that was jabbing into her, and she ended up bleeding, and he wouldn't stop. And it's a crazy story. She got out of the chair, ran from the room. The dentist is chasing her. She crawled out of the the sliding window at a dentist's office or doctor's office. She crawled out of the window to get away from this guy. He was charged with battery. Yeah, you can be charged. We have to have consent. Good? Just because somebody's in medical doesn't mean that we have the right to do whatever we want with them. Okay. It's a graded checkpoint. We're going to close that privacy curtain because it's a graded checkpoint. Yeah, patients need privacy. We're going to wash our hands after we close this curtain. This curtain is not clean. Who touches that curtain? Everybody. The staff, the visitors, the patients, everybody touches this curtain. It is not clean. It is only taken down and physically washed about once a year. In between, it's sprayed with disinfectant spray, but when you touch that curtain, you need to wash your hands. Good? Those 2 things should be tied in your brain forever. And it's also a graded checkpoint. Okay, so we we can't touch that patient until our hands are clean. Please remember that. You cannot touch that patient until your hands are clean. You also have to get your supplies, and you need clean hands to get your supplies. So your opening sounds like this. Where is it? Oh, we'll get there. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to insert name of skill here. Is that okay? I'm going to close your curtain, wash my hands, and get my supplies. That's the opening. We're going to do that before every single skill. The best place to practice the opening is in your bathroom at home. You've got a person to talk to, the one in the mirror. You've got a curtain to close, the shower curtain, and you got a sink right there to wash your hands. Send everybody else out for ice cream because you'll sound weird talking to yourself. But you make a little index card, tape it to your mirror, and every time you walk in that bathroom, say that opening. Okay, good? Good. I have this is a screenshot from the online course. Remember we talked about that online course that you're going to be enrolled in? Let me show you how this online course makes learning interactive. So I have a whole video on this that you can watch. And then we have an activity. So let's do this activity together, okay? Let's try this activity together. So you're going to see 8 steps here, and we have to put them in the right order. It's a drag and drop activity. So what is our first task? How do we know what to do with each patient? What do we do? Yeah, we need to know what to do. So we're going to read that care plan first. Right. How did I? Jake, write down 117 or 111. 111.
You got it?
Okay. Sorry, guys. Okay, so we read the care plan. The second step was knocking. So after we knock, what do we want to do? Okay, so greeting, yes, but that goes along with they come before us. Remember that. Patients come before us. Okay? So we're going to greet our patient by name. Now what do you want to do? Okay, because patients come before us. Okay, yes. So somebody said wash your. If you wash your hand now, it would almost be a little presumptuous. We're kind of assuming the patient is going to let us do what we want to do. We have to get permission first. Then close. So we're going to get permission. Then we're going to close that curtain. Then we're going to wash our hands and gather our supplies. Let's see if we're right. We hit the check button and we got our gold star. Yay.
As you walk in,
It is less than 20 seconds. Well, take a look at the clock. Okay. Take a look at the clock. When it gets on the 5, I'm going to start. Ready? Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? I'm here to whatever. Is that okay? I'm going to close curtain and wash my hands. That was less than 15 seconds. And I went slow. Okay, plenty of time. So everybody see how that activity can help you put the pieces in order? I have one of those activities for every single skill, every principle and every skill. And you all have access to that today. So this is our opening. This is our cardinal rule. Do not touch that patient until your hands are clean. Let me explain why. Let me explain why. We have to think in a clinical setting about who is at risk here. Okay, let's talk about this lady. She is here because she's sick or injured or weak or something is going wrong. She would be at home if she could. She's not at home, so she's clearly not healthy, right? That means her immune system is currently busy. And we put her in a place with a lot of other people who are sick. So if her immune system is currently busy and she's in a place with a whole lot of pathogens, she is at risk. Do you guys see that? So when we're talking about this specifically, it's to help reduce the amount of hospital-acquired infections. Hospital-acquired infections affect about 1 out of every 25 patients. That means that when you're a patient at a hospital, 25 of your other closest patients, one of you is going to get something that you did not come in with. Could be MRSA, could be COVID, could be pneumonia, could be a catheter-acquired infection, could be a surgical site infection, it could be C. diff. You're going to get something you did not come in with. And you're not going room to room, playing with other patients. The way that you get it is through the staff. Staff members go in, touch something, and then bring that something to you. Make sense? So in a clinical setting, your patients are the ones at risk here. So let me put this in terms you can understand. 1 out of every 25 people gets an infection that they did not come in with, and it's going to kill 1 out of every 12 of those. So, I mean, this causes a lot of death every year. It's actually the third leading cause of death in healthcare is a healthcare acquired infection. I mean, that's big. That's like heart disease, cancer, and errors. That's not good. That's not good for the home team, guys. We got to do better than that, right? So these hospital-acquired infections can be deadly. So let me give you an example. How many of you guys like to ride roller coasters? Anybody? Okay, so in general, a basic roller coaster has about 25 seats. So imagine you go to get on a roller coaster and the guy says, oh, enjoy your ride. And just so that you know, one of you guys is going to fall out. Have a good trip. Bye. Would you get on? Because that, would result in injury or death, right? Every time you get admitted to that hospital, you are having the same risk. Same risk. We got to do better. Good? You guys understand why this is important? All right. So we know skill rules. We follow the care plan, the whole care plan, and nothing but the care plan. We observe for any changes, abnormalities, or pain, and we report those observations to the nurse. Every skill starts with an opening. Every opening starts with a knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? I'm going to close your curtain, wash my hands, get my supplies. So we know 2 out of 11. We're going to move on to the closing, which will be number 3 for us. This is going to be done at the end of every skill. I have a video on this if you'd like to watch it. Your notes are on page 35. And the closing is a little longer. There's 8 C's to the closing. Thankfully, they all start with C. So closing has 8 C's. And here they are. Your patient needs to be clean and safe. Safe is a big one. They need to be comfortable. We actually need to hear that word comfortable. They need to be covered somehow. The rule here is we don't want to see knobby knees. I should not ever see a patient's knobby knees. If they don't have clothes on, they need to have a sheet on. Okay? They have to be covered. We got to open that privacy curtain and give them their call light. Then we're going to go clean our hands because once we're done with the patient and their environment, you've got to clean off whatever cooties you encountered. If you have to chart, you would chart after you wash your hands, and I'll explain why in a minute. But we have a rule that we end skill with clean hands. It's a checkpoint. End skill. So what's the very last thing you have to do? Clean your hands. Doesn't matter how many times you cleaned up beforehand. End skill with clean hands. So it's always the very, 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 very last action we do. If you do anything else after you wash your hands, what do you have to do again? Clean your hands again. Good? Got it? All right. So we always leave our patient looking better than you found them. That's a rule that my nursing teacher taught me 35 years ago. I still use it to this day. Leave your patients looking better than you found them. So look around, make sure everything is nice and neat, and it's a graded checkpoint. Okay. Keep the bed in the lowest position. We'll talk about that a little bit more in an upcoming lesson. Why? It's a graded checkpoint. They want to hear that word, comfortable. Why? It's a graded checkpoint. Emotional comfort counts too. So look around, ask, do you want your remote control? Do you want a magazine? Do you, what preference? Do you want the head of the bed up or down? Find a preference. For the test, I just have you stick to a magazine, offer them a magazine. Would you like a magazine before I go? It just shows that we're addressing this. It's a graded checkpoint. They need to be covered. I don't want to see their knees. Clothes are fine. Sheet is fine. Knees are not. Make sure they're covered. Why? It's a graded checkpoint. I didn't make this stuff up, guys. I'm showing you. These are the actual checklists. If you miss any of these, you get a deficiency, and that's what's going to count against you. We're going to open the curtain. Now, you can ask if they want the curtain open or not. As a general rule, the curtain should be open. Closed curtains promote isolation, which promotes feelings of inadequacy and depression, and that will affect their ability to heal. I don't like closed curtains all the time. People are social creatures. We heal better when we can see other humans. I didn't write the rules. They just do. It's a graded checkpoint. And then the call lights go directly in their hand. If they have a stronger hand, put it in the stronger hand. There is a skill that requires that, but it needs to be in or near their hand at the end of the skill. Why? It's a graded checkpoint. And then we're going to wash all of those cooties away. Okay. Now, if we have to end skill with clean hands. So if we have to document, you don't want to touch that pen that's going to go in your pocket and home with you at the end of the day with unclean hands. Think about that. So you have to wash your hands before you pick up a pen to document. Otherwise, you're transferring that patient's cooties all over this pen, and it's going to go in your pocket. And you're going to go in and out of every room with that cootie available to you. So we wash our hands, we document, and then we wash our hands again. Got it? Any questions? We must end the skill with clean hands. It's a checkpoint. These are all new for you guys. I didn't have these before. I didn't show the correlation between what I'm telling you to do and the checkpoint. So I'm hoping that that helps you guys understand why each one of these steps is important. All right, so we have to end the skill with clean hands and a patient that feels cared for and cared about. So we're going to learn hand washing. This is on page 44. I have a video for it. This is your checklist here for hand washing. Tells you exactly what's expected of you. And step-by-step instructions are on page 45. when it comes to hand washing, we kind of have to think about where we're washing our hands. Usually it's in a bathroom or some other area that's kind of enclosed off. Those areas are usually a little bit warmer than other areas because we don't like to be chilled when we get out of the shower. We usually are undressed in those areas, so they're always a degree or two warmer than other areas. So keep that in mind, right? We already have warm. We've been trained to turn the lights off when we're not in a room, so we have dark. Now, pathogens need three things to thrive. They need warm, check. They need dark, check. And they need moist. Well, if we're washing our hands, there's our moisture. So we have to keep this in mind, right? This is the ideal breeding environment for pathogens, is anywhere where we have warm, dark, and moist. And I'm going to explain why that's a problem in just a minute. So these are our checkpoints. These are our instructions. You can see that they're going to line up exactly. So this tells us how to get these checked off. When we go to turn a faucet on, we can touch the faucet, no problem. Your dirty hands can touch that faucet because it's dirty. In fact, it's the dirtiest thing in the bathroom. We touch that faucet handle with unclean hands all day long. So it's okay to touch a faucet handle as long as our hands are unclean. But at the end of hand washing, when we have clean hands, can I touch that faucet? No, we're going to have to address that. When you turn the faucet on, you want to wet your hands. Do not put soap directly in dry hands. It doesn't distribute. It won't lather well. So we have to wet our hands before we put soap on. And I know this is going to be kind of hard for some of you because you're used to just getting some soap and then getting some water and rubbing together. A checkpoint, and you can see the checkpoint in your book. A checkpoint is that you have to wet your hands before you lather. Well, get some soap, get a lot of soap. They grate on bubbles. They do. Get soap. You want to work up a good rich lather. And then we start rubbing. You want to rub all areas, and it has to take at least 20 seconds. At least 20 seconds. So we are going to rub. We are going to rub the tops of the wrists, the backs of the hands, in between the fingers, in between the thumb and index finger, the bottom of the hand by the pinky, all areas for at least 20 seconds. You want to keep your hands lower than your elbows, and you want to keep them over the sink. So wrists, back of the hands, in between the fingers, between the thumb and index finger, and the bottom of the hand by the pinky. All of those areas for at least 20 seconds. Once you get that done for at least 20 seconds, then you can move on to your nails. These are the areas that are most missed when we wash our hands, so pay special attention to anything in red. We're real good about getting this part, but look at those fingertips. Look at this area. We totally ignore our nails most of the time. You have to wash for at least 20 seconds. Don't sing. COVID taught us to sing. COVID did. I mean, they taught us to sing. The problem is that for the test, you're going to be nervous. What do you think happens to your singing speed when you're nervous? What do you think happens to your singing speed when you're nervous? Speeds up. So it's no longer an accurate measurement of time. So for the test, there's going to be a clock right above the sink. Use the clock. That evaluator, when you wet your hands and you put soap on and you bring your hands together, at that point, that evaluator writes down where that second hand is on their paper. There's actually a place for them to write that in. They write down where the second hand is. And then when you're done rubbing and you move on to your nails, they look and see where that second hand is and write it down. If it's not at least 20 seconds between, you have failed hand washing. 19 seconds is not enough. 20 is minimum. So now that you've scrubbed for at least 20 seconds, we're going to move on to our nails. We're going to run our thumb down each one of our thumbnails to get our cuticles. And then we'll circle the nails on the palm of our hands to get under the nails. Then we can rinse. Don't touch the sink or the faucet. They're not clean. Your hands are. After you've rinsed, you're going to tap. A lot of us do this to get the water off. Remember our environment, warm, dark, moist. We already have warm, we already have dark. When you do this, you add moisture all around that environment. We want that moisture controlled, confined. So we're going to tap to keep that water inside the confines of the sink. Good? Don't flick. And then we'll get some paper towels. Leave that faucet running. Don't touch that faucet yet. Dry your hands. I don't care how many paper towels you use. Use 2. Use 8. Use 57. I don't care. Nobody is counting. But dry your hands. Dry them well. And then get a clean, dry paper towel to turn that faucet off. Don't don't turn the faucet off with that paper towel you use to dry your hands with. Wet paper towels rip. What's the dirtiest thing in the bathroom? That faucet handle. And if that wet paper towel rips, you can recontaminate your hand without even realizing it. And your patient has an immune system that is currently compromised. Dry paper towel. Good? Okay. And then we can throw that paper towel away after we turn the faucet off with that paper towel. So these are our checkpoints. We wet our hands and applied soap. We used friction, create a lather, cleansing the front and back of hands, between fingers, around cuticles, under nails, and wrists. Provide cleansing friction for a minimum of 20 seconds with hands lathered with soap. We're going to rinse. Use clean paper towels to dry hands and wrists. Dispose of those paper towels in the trash. And end hand washing with clean hands, avoiding recontamination of hands before procedure is completed, like having direct contact with the faucet handles. Good? All right. So I'm going to show you the video for this so you can see how this whole hand washing works. And then we're going to do that activity to see if we know the steps. Okay. Yeah. As I approach the sink, I can touch the faucet with my unclean hands because the faucet is not clean. I'm going to turn the water on to a comfortable temperature and wet my hands thoroughly. You must rub with friction for at least 20 seconds. I'll get enough soap to produce a nice rich lather and bring my hands together to start timing. I'm going to rub the tops of my wrists on both sides, the back of my hands, interlacing with my fingers, in between my thumb and index finger, making sure that I cover all areas with sufficient friction. The bottom of my hand by my pinky and the palm of my hand. After cleaning my hands, I'm going to go down my fingers with my thumb to clean the cuticles. I'm going to circle my nails on the palm of my hand and then rinse. Being careful not to touch the faucet or the inside of the sink. After rinsing, I'll tap to keep the water confined in the sink and then dry my hands thoroughly with paper towels, being careful not to touch the unwashed portion of my lower arms. I'll throw those away and get a clean dry paper towel to turn the faucet off because wet paper towels may rip and contaminate your hands.
3, 2, 1. If anyone did not get a review sheet, please write your name on this sheet here, and I'll make sure you get one on Wednesday. I have one left. Whoever would like that one first. go ahead and pass it on down. I'll make sure you guys get one on Wednesday with the class 2 review sheets.
You can also get them on FLCNA training. You can download them if you want, if you want access to them right away. All right. Did you notice on that video, these are the new videos that I'm in the process of doing. Did you notice on the new videos, I put the actual checkpoint at the bottom of the screen. So you can see the action on the screen is checking that checkpoint off. So the new videos are going to have that. I think I've got 6 of the new ones done so far. I'm a work in progress. All right, so in the online course, you have access to that checklist as well as the video. And then we have an activity. So let's see if we can do this activity together. What is our first action here? Turn water on. Okay. What is our next step? Wet hands. Okay. Apply soap. Very good.
Lather all surfaces.
Let's lather. Yep. And then rub, right? What do I have to do? You got soap. You got to rinse all surfaces and then turn the faucet off with a barrier. Good? Take that down for a minute. Thank you. All right, let's check it and see. And we got our gold star. Good job. Good job. Okay, go ahead and throw that up. My problem with hand washing is how to count that 20 seconds. I follow you while doing it. I can't count it. No, Helen, you're not going to count. You're going to use the clock. So in the testing center, there is a clock right above the sink. That is what the evaluators are using. So when you get your soap on your hands and you start to rub, you look at the clock and see where that second hand is. You can wait until the second, you can just stand there and wait until that second hand gets to the 12 if you want to. And now I'm going to start rubbing. And then, you go down to the 4, which would be 20 seconds. Okay, go ahead and take that down. Okay, so you're not counting, you're not singing, you're using the clock for timing. Very important. And that's what this is going to tell you. Don't sing. During the test, you are going to have to wash your hands physically at the sink. Go to the sink, get them wet, wash them, just like I showed you on the video, for your first skill. At the beginning and the end of the first skill, you actually physically wash your hands using the technique. After your first skill is over, the evaluator is going to tell you you can simulate hand washing. Simulate means say. Those RN evaluators, they don't want to be there. They really don't. These are nurses that have been in nursing longer than dinosaurs, but they aren't quite ready to retire yet. They want to be at home in their pools, drinking their margaritas. They don't want to be watching you wash your hands 6 times. And you wash your hands 6 times. And you wash your hands 6 times. And by the time they're done with the day, they've watched 48 hand washings. That's boring. I don't care who you are. So for the test, they find ways of compressing the time down. And this is one of the ways they're going to do it, is after the first skill is done, they're going to tell you can simulate hand washing. Simulate just means say. I would wash my hands now. Okay. All right. So let's talk about indirect care. Indirect care is something that it's kind of intangible that they're going to be grading you on. Indirect care is basically treating the patient the way you would want to be treated if you were the one in the bed. That's really what indirect care means. But it's going to be comprised of things like eye contact, tone of voice, rate of speech, explanations, posture, body language, all of those intangibles, what we call nonverbal cues. if I'm standing here and I'm standing up straight and I'm looking at you guys, you feel like I'm interested in you, that I'm, you know, I'm paying attention to you. But if I spent the entire class just kind of like this and, you know, had kind of slouchy posture and never really even looked at you and talked, you know, kind of to the wall, and would you guys feel like you got what you needed? Even if I gave you the same information, you would still feel like it was inferior because of the method it was delivered in. Does that make sense? That's what this is. This counts. It doesn't just count on the test, it counts in real life. And I know you guys have all seen workers out there that did not want to be doing the job they were doing, and it came through in everything that they did. I'm not talking about healthcare, I'm talking in general. I've had some crappy servers at restaurants. I've had some horrible cashiers at grocery stores, you know, and it's not because they didn't scan the groceries right, it's because of this. This speaks loudly without words. You're graded on it too. So, yeah, well, you want to take pride. You're nervous, I get it, but you still want to stand up with pride. You want to face the patient. You want to speak to them. Slow down your speech a little bit. Even though you're nervous, you're going to be, try to slow down so that your patient understands what you're trying to convey to them. Good? All right, homework. Look at that. I'm doing really good on time. I'm so proud of me. I'm normally like 3 minutes over. These new slides did help. All right, so let's go over homework real quick. Remember, third column is your homework. In the yellow book, you are going to read chapter 1. In the spiral book, you are going to take the test on page 181, and you're going to grade that test with the answer key at the very back of the book on page 201. And when you come into class on Wednesday, if you have any questions about what you read, write them down and bring them to class, and I'll be happy to answer them. But before you go, I want to show you something really quick. I want you to open your yellow book. I know it's not the one we work in class, but open the yellow book to the index. You know, at the very back of the book, it tells you where to find stuff at the very, very back. I don't have a yellow book. Okay, I'm going to borrow yours. So go to page... Oh. Sorry. Okay, go to page 271. And in the middle column, I want you to look up care plan. Now, what do we know about the care plan real quick? What do we know about the care plan? We have to follow it. It's pretty important, right? Kind of dictates everything we do. So that care plan should be all over this book, shouldn't it? That care plan should be like on every page of this book. How many pages is it listed on? Yeah, and in fact, they go together, page 7 and 8, because the paragraph kind of just... So let's go to page 7 and 8 and see what they say about the care plan. I mean, they've got to say something about it being important, right? That it dictates everything we do. So let's look on page 7, see if you can find the care plan. Do they tell you how important that care plan is? No. That's why you're going to take this book home and use it for homework reading. It isn't worth much. That's why I wrote the book that I wrote. Now, this book does have some background information that I do not give you. It is valuable for that. You need to learn, you know, some things that are in the book that I'm not going to cover, like, you know, the different team members and their roles, ages and stages of development. It's going to go over nutrition and things like that. But everything that you really need to know, I'm covering in class. Okay, so don't bring this book back to class. It doesn't even cover the care plan well. All right, good? Good. All right, so we're going to read the yellow book, take the test on page 181 and grade it. Review sheets, I'm sorry that kind of got away from me. You do have access to these review sheets on your syllabus at the very top of your syllabus. Way up here, it has flcnatraining.com. That is the website you can see the live stream on. It also has links to everything that, like the ebook, everything that we went over, and it has all of your review sheets as well that you can print off. Okay? You survived. Class 1. Is anybody lost? Did I go too fast? That's for you. You don't turn that in. That is strictly for you. The answers are on there. If you do these review sheets when I give them to you or when Jake gives them to you in class, they make a review packet for when you're testing because it covers everything you need to know. These review sheets are amazing. Hope to see you guys all on Wednesday. Please be in your t-shirts on Wednesday. Just comfortable pants are fine and closed-toed shoes. If anybody has any problems or any questions, please feel free to stay after. If I went too fast, please let me know. I want everybody to come back to class. This is your class. I'm just here to facilitate it. Okay. Have a great week. I'll see you on Wednesday. Bye-bye.